మహమ్మారి, చేయూతనివ్వలేని రోగం, కుటుంబ సభ్యులు బంధుమిత్రుల చివరి చూపుకు నోచుకోని దేహం, యావత్ ప్రపంచానికే ఓ ప్రాణగండం. ఈ భయానక పరిస్థితుల మధ్య మేమున్నామంటూ లక్షలాది మంది ప్రాణాలు కాపాడిన మహనీయులే మన డాక్టర్లు. ప్రాణాలకు తెగించి కోవిడ్తో పోరాడిన ధీరులే మన వైద్య సిబ్బంది. ప్రాణాలు కాపాడితే డాక్టర్లే దేవుళ్ళంటున్నాం, చేతులెత్తి మ్రొక్కుతున్నాం, ఆకాశానికి ఎత్తేస్తున్నాం. పరిస్థితి విషమించడమో, సమయం మించడమో, సమాచార లోపమో, ఏదేమైనా వైద్యం చేసినా బ్రతికించలేని పరిస్థితులు ఎదురైనప్పుడు కట్టలు తెంచుకున్న కోపం, హద్దులు మీరుతున్న ఆవేశం, మీరే మా దైవమంటూ మ్రొక్కిన ఆ చేతులే హాస్పిటల్స్, డాక్టర్లపై దాడులకు దిగుతున్నాయి. ప్రాణాలు కాపాడే వైద్యులపై పిడిగుద్దులు విసురుతున్నాయి. వైద్య సిబ్బంది వణికిపోయేంతలా వికృత చేష్టలకు దిగుతున్నాయి. డాక్టర్లు, స్టాఫ్ నర్సులు, టెక్నీషియన్లు ఇలా ఒకటేమిటి, వైద్య సిబ్బంది అందరిపై వరుస దాడులు. ఈ దాడులు ఇలాగే కొనసాగితే, ప్రాణభయంతో వైద్యం ఆగితే, వైద్యం చేయలేమని చేతులెత్తేస్తే, ఒక్క క్షణం ఆలోచించండి. జరిగే నష్టం ఊహించగలమా? పోయే ప్రాణాలు లెక్కగట్టగలమా? దాడులకు తెగబడే వారి ఆవేశంలో న్యాయం లేదని మా ఉద్దేశ్యం కాదు. దాడులతో పరిష్కారం దొరుకుతుందా అనేదే మా సూటి ప్రశ్న. తప్పు ఎక్కడ జరుగుతోంది? చట్టాలు చెబుతున్నదేంటి? లోపం ఎవరిలో ఉంది? మార్పు ఎప్పుడొస్తోంది? మన భావి తరాల కోసం మన వైద్య సిబ్బందిని రక్షించుకోవాల్సిందే. చేతులెత్తే ఆవేశానికి పరిష్కారం చూపాల్సిందే. ఇదే ప్రశ్న అందరినీ కలచివేస్తున్న ఈ క్లిష్ట పరిస్థితుల్లో వైద్యులు బాధితుల మధ్య అంతరాన్ని చెరిపేందుకు, వైద్య సిబ్బందిని రక్షించేందుకు, బాధితుడి ఆవేశానికి అర్థవంతమైన పరిష్కారం చూపేందుకు సోషల్ మీడియా వేదికగా మహా సంకల్పం చేపట్టారు అమెరికా నుండి మన తెలుగు వైద్యులు డాక్టర్ కిరణ్ దింటియాల. రండి, మీరు మా మహా సంకల్పంలో భాగస్వాములవ్వండి. ఈ శనివారం సాయంత్రం 6:30 డాక్టర్ సంజీవిని ఛానల్లో వివిధ రంగాలకు చెందిన ప్రముఖులతో బిగ్ డిబేట్, సేవ్ అవర్ సేవియర్స్. వైద్యులు, వైద్య సిబ్బందిపై దాడులు ఇంకా ఆపండి, పరిష్కార మార్గాల వైపు అడుగులు వేయండి. రండి, డాక్టర్ సంజీవిని. ఇది సామాన్యుడి చేతిలో ఆరోగ్య సంజీవిని. కరోనా మహమ్మారి, చేయూతనివ్వలేని రోగం, కుటుంబ సభ్యులు బంధుమిత్రుల చివరి చూపుకు నోచుకోని దేహం, యావత్ ప్రపంచానికే ఓ ప్రాణగండం. ఈ భయానక పరిస్థితుల మధ్య మేమున్నామంటూ లక్షలాది మంది ప్రాణాలు కాపాడిన మహనీయులే మన డాక్టర్లు. ప్రాణాలకు తెగించి కోవిడ్తో పోరాడిన ధీరులే మన వైద్య సిబ్బంది. ప్రాణాలు కాపాడితే డాక్టర్లే దేవుళ్ళంటున్నాం, చేతులెత్తి మ్రొక్కుతున్నాం, ఆకాశానికి ఎత్తేస్తున్నాం. పరిస్థితి విషమించడమో, సమాచార లోపమో, ఏదేమైనా వైద్యం చేసినా బ్రతికించలేని పరిస్థితులు ఎదురైనప్పుడు కట్టలు తెంచుకున్న కోపం, హద్దులు మీరుతున్న ఆవేశం, మీరే మా దైవమంటూ మ్రొక్కిన ఆ చేతులే డాక్టర్లపై దాడులకు దిగుతున్నాయి. ప్రాణాలు కాపాడే వైద్యులపై వణికిపోయేంతలా వికృత చేష్టలకు దిగుతున్నాయి. డాక్టర్లు, స్టాఫ్ నర్సులు, టెక్నీషియన్లు ఇలా ఒకటేమిటి, వైద్య సిబ్బంది అందరిపై వరుస దాడులు. ఈ దాడులు ఇలాగే కొనసాగితే, ప్రాణభయంతో వైద్యం ఆగితే, వైద్యం చేయలేమని చేతులెత్తేస్తే, ఒక్క క్షణం ఆలోచించండి. జరిగే నష్టం ఊహించగలమా? పోయే ప్రాణాలు లెక్కగట్టగలమా? దాడులకు తెగబడే వారి ఆవేశంలో న్యాయం లేదని మా ఉద్దేశ్యం కాదు. దాడులతో పరిష్కారం దొరుకుతుందా అనేదే మా సూటి ప్రశ్న. తప్పు ఎక్కడ జరుగుతోంది? చట్టాలు చెబుతున్నదేంటి? లోపం ఎవరిలో ఉంది? మార్పు ఎప్పుడొస్తోంది? మన భావి తరాల కోసం మన వైద్య సిబ్బందిని రక్షించుకోవాల్సిందే. చేతులెత్తే ఆవేశానికి పరిష్కారం చూపాల్సిందే. ఇదే ప్రశ్న అందరినీ కలచివేస్తున్న ఈ క్లిష్ట పరిస్థితుల్లో వైద్యులు బాధితుల మధ్య అంతరాన్ని చెరిపేందుకు, వైద్య సిబ్బందిని రక్షించేందుకు, బాధితుడి ఆవేశానికి అర్థవంతమైన పరిష్కారం చూపేందుకు సోషల్ మీడియా వేదికగా మహా సంకల్పం చేపట్టారు అమెరికా నుండి మన తెలుగు వైద్యులు డాక్టర్ కిరణ్ దింటియాల. రండి, మీరు మా మహా సంకల్పంలో భాగస్వాములవ్వండి. ఈ శనివారం సాయంత్రం 6:30 డాక్టర్ కామ్ సంజీవిని ఛానల్లో వివిధ రంగాలకు చెందిన ప్రముఖులతో బిగ్ డిబేట్, సేవ్ అవర్ సేవియర్స్. వైద్యులు, వైద్య సిబ్బందిపై దాడులు ఇంకా ఆపండి. పరిష్కార మార్గాల వైపు అడుగులు వేయండి. రండి, డాక్టర్ కామ్ సంజీవిని. ఇది సామాన్యుడి చేతిలో ఆరోగ్య సంజీవిని.
Good evening, everyone. Sir, you are on mute.
Good evening, everyone.
Good evening, sir. Let me set things.
Good evening, everybody.
Good evening, sir. Good evening.
Good evening.
You are on time.
Very good evening.
Good evening.
Lakshmi ma'am, Manoj sir, Hiren sir, Ramya garu, everybody is in. And
Good evening, everyone.
Good evening.
Good to see everyone. Second.
Hello, good evening, everyone. Hope I'm audible.
you are perfectly audible.
You. Hi, CD.
Good evening, Ramya garu. Good evening, Manoj.
Sir,
Yeah, very good evening. Very good evening, sir.
What an energetic evening it is.
Good evening.
Really.
Good evening, everyone.
Very
Good evening, sir.
good evening.
Krishna sir,
Ah,
good
good
evening.
Good evening, Ramya.
After a very long time.
Yeah, of
Happy
course.
to see you like this, sir.
Hello, Lakshmi Devi. How are you?
Hi, hi Kiran, I'm fine.
Hi, madam. Good evening,
He is
madam.
my classmate.
Good evening, sir.
Oh,
Good to see you. Good to see you. I think we still have a couple more people to join, right?
Yes, sir. Three
Yeah.
more people yet to join.
Dr. Gopi Chand, Dr. Karthik,
And Seshu garu kuda join అవుతానన్నారు.
Seshu, and who
And
else?
ఇంకొక డాక్టర్ కూడా ఉన్నారు.
జయంతి.
Lady, one second.
Dr.
And
Jayanti.
Jayanti garu.
జయంతి, కార్తిక్ తుమ్మల గారు వచ్చారు. జాయిన్ అయిపోయారు.
Yeah, Karthik. And what we'll do is, because this meeting is going to be streamed live and also this is a national problem, I think we should converse in English today so that people all over India can see us and understand us. I think we have two more people joined us. Dr. Karthik Tumala and Mrs. Jayanti
Yeah.
Talluri. And join. Welcome.
Good evening,
Dr.
everyone.
Karthik.
Good evening, who is on other side of the world. This is consultant and lawyer from India, Hyderabad.
Good evening, madam.
Good evening. So, good evening, Mr. Chetan. Are we waiting for someone to join?
Yes, we are waiting for one more person to join, which is, I think, Dr.
Dr.
Gopi.
Gopi Chand.
Gopi Chand garu.
Oh, Srinija, you want to say him?
Yeah, I'm calling him. Meanwhile, we are already live, sir, and it's recording. Maybe we can start. Meanwhile.
Yeah.
Yeah, how it goes, sir? Any idea how we were going to discuss the program?
Yeah, right. What we want to do is we will briefly introduce the topic to people on this call.
Okay.
And then we'll also briefly introduce ourselves so that people know who we are. And once that is done, we'll address the problem. My goal for this session is understanding the problem, exploring it, because we won't be able to find solutions to this humongous problem in one session. So, but this session should become the one that should draw attention from people, that we doctors are coming together. And of course, that is already happening everywhere in the country, but we are trying to solve this problem and we increase awareness among everyone about this problem. So that is what I think my goal for this program is today. And of course, you all can chip in and add your thoughts of what you think the goal should be. We discussed a little bit with everyone individually. I personally discussed with almost everyone here individually what we want to do. So with that, also now welcome Dr. Gopi Chand, who just joined us. That's great. So let's get started with our program, Save the Saviors. This is a panel discussion about protecting doctors from the violence that is happening across the nation. And this is Dr. Kiran Dintiala. I'm a physician, author, and also a stress management consultant. I have, come to United States many years ago, but I was born and brought up in India. I'm from Vijayawada in Andhra Pradesh. And when I saw this problem on TV, I think almost a month ago, where a doctor was brutally attacked by a group of people and almost they killed him. We caught that on CCTV. I say, it's like just terrible. This is just terrible. This shouldn't be happening no matter what the situation is. And so thought that I think we need to do something about it. And then I started speaking with various people. I spoke with Dr. Karthik, who represents IMA in Vijayawada, and he has been doing a lot on this front. So we invited him. I spoke with Dr. Gopi Chand, who is my mentor. And he also responded kindly, and he said, I think we need to do something about it. I spoke with my classmate, Lakshmi Devi, and asked her, and she joined us. And then I know Ramya, who is a journalist, psychologist, and Jayanti, she's a medical legal expert. She works at Rainbow Hospital in Hyderabad. And then my friend Nagesha Rao, Srinija here. They have been great source of support for me in conducting any of these programs. And Krishna Mohan has kindly agreed to moderate this program. And then we invited Mr. Niranjan Rao Garu to this, and Mr. Manoj Kumar. Every single person is important in this fight against violence. And then when I started looking at the literature, what I found is very interesting. There has been escalating evidence that this violence has been happening over the past decade. There is a very good article in 2018 published in Indian Medical Journal. Indian Journal of Medical Research in 2018. Very good article about delineating all the problems about this violence. What they said is for the past 10 years, there is increasing violence, and the reasons are not entirely clear. We are trying to figure it out. But when I look back in America, then I went to NEJM, New England Journal of Medicine, and we have the same problem in a different way. So it is not just a problem in India, it is a problem across the world, all around the globe. In China, a dentist was killed, I think a couple of years ago. Actually this patient, 20 years after the dentist treated him, he came back and killed the dentist. This is crazy. So these attacks against doctors are not always impulsive in that moment, depending on what happened, but actually some people hold grudges and come back and kill later. Something similar happened in Boston, in America, in Boston, in the state of Massachusetts. A surgeon was killed at Brigham's and Women's General Hospital. So these things are happening everywhere. So what should we do to solve this problem? That is the focus of this meeting. And we should do everything that is possible. My very clear message, no matter what we discuss in this meeting, my very clear message to everyone who is watching this is, I'm totally condemning this violence at any level. This shouldn't be happening. Because doctors are nice and they're taking care of you, you think that, you can do whatever you want. That is a question I have for the public. Are you going and killing politicians? Every year you get a lot of promises and nothing happening. Why are you not attacking them? I'm not saying to attack them because you're afraid that you're going to get arrested. People need to think about this. No problem can be solved with violence. We can only solve calmly, peacefully, rationally. But let us see what is preventing us from solving this problem in a calm way. With that, I'm going to hand over to Dr. Karthik, and then I want everyone to go around the table and then introduce themselves for a couple of minutes, and then Mr. Krishna Mohan will then moderate this session, and we'll take it from there. Dr. Karthik, please go ahead.
Yeah, hi everyone, and I should thank Dr. Kiran to initiate such a good process of Saving the Saviors kind of program on this platform. We have been doing it. I'm a part of IMA. I'm the secretary of IMA Vijayawada from the past 2 years, and I'm the secretary for Cardiology Society of India for AP State. Basically, I'm an interventional cardiologist. I've been practicing in Vijayawada from the past 7 years, and been managing hospitals and been a part of the healthcare for a long time, because it's a family legacy that 3 generations of us are doctors, and we are almost like 38 of us are doctors in our family. And coming to the platform, it is nice to have medical legal advisors, advocates, and NGOs and doctors being a part of it, and making a thought process and making couple of directions where we are heading to, and making a couple of probably some more brains into it and see what the actual root cause of it. It is nice that Kiran has went up to looking up literature, how it happens even in China and even in US. These are more, I would say, as individual kind of very rare incidents that happen there. But in India, it is almost kind of every alternate day that you find some amount of violence all across the country. And you see, 2 days back, we had something in Bangalore. 1 week back, we had something in Maharashtra. And it's been happening even in Assam, Arunachal Pradesh, and Delhi. And, you can name any place, you have it. So we have been, as a part of Indian Medical Association, leading the doctors organization from the front. We have been doing everything possible, getting awareness to people, and actually pressurizing or lobbying with the government to make couple of laws enforced. We have been having Clinical Establishment Act of Andhra Pradesh in the undivided state of Andhra Pradesh itself, which says any act of violence inside the medical establishment or against the doctors is a offense, and it has been given 3 years to 5 years of imprisonment, and even 10,000 to 1 lakh amount of penalty itself. But the problem is, being a medical facility or medical law is under the state purview. We don't have a national law, and getting into CRPC or penal codes is again an issue. I think our lawyer part of it can actually talk about it and probably give us some more input so that we can ask the government and lobbying it up. And we all condemn our violences, all these violences against doctors and paramedics as well. And we have been doing all protests and doing the necessary activities. We have been pushing for a enforced law as an establishment, clinical establishment law, which has been only for registration of the medical facilities. It also should include a couple of penalties for people who have been rash or people who have been negligent against the medical establishments as well. And of late, if you see, there has been a social media which talks of its mouth and of its foot. So you don't know people who actually create that kind of ideology and they drive it, but that makes things more miserable for people who practice medicine in this country. So we need to have an ideology which has to be driven into the society, where we keep talking, or when people invite us for a couple of talks, we keep telling them, if somebody is born, they have to die. So there is no point we telling that they don't die. And death has to be accepted. The first thing that people don't accept is death. Death is a part and parcel of life. It is only in the due course of our life that we get to medical attention. So we don't know the pain, or it's probably prolonged in a couple of areas. But still, basically, death has to be accepted. That is where we lack. And regarding the various healthcare facilities being targeted is also because of the financial issues, and it is more of a corporate driven healthcare facilities now. And people have to accept, when you have quality and you get in processes which get more costly, and you have to bear it, or else it's going to be a
Your voice is fading, Dr. Karthik. Your voice is fading.
Am I okay now?
Yeah, now you're good.
Yeah. So if you look at our government healthcare systems now, the PM has announced that there are going to be a bigger budgetary allocations to the healthcare facilities of all across the country. From the past so many decades, this has been neglected in government healthcare. If you look at NHS or the healthcare system in US, it's almost, I would say, run by the government or the insurance companies. But here it's the other way around. That is where most of the issues or the friction happens. And if we can reduce that kind of friction, definitely we'll see a much brighter future all across. So I think with this intro, I think we have a lot of questions to be discussed and a lot of things to be discussed. I would request Mr. Krishna Mohan to continue. Thank you very much, Kiran, for giving me this opportunity.
No problem. Thank you, Dr. Karthik. And Dr. Gopichand, would you please introduce yourself for a couple of minutes, and then Lakshmi Devi, and then Niranjan Rao Garu, and then Manoj, and then Jayanti Madam, and Ramya. So just keep moving on. Yeah.
Okay. Myself, entrepreneur and also a doctor, let me put it that way. And I've been into different aspects related to medical education reforms, from moving into problem-oriented medical education into practice-oriented medical education. Fundamentally, that is what is required right from the beginning of the forming of a doctor. Doctor is made as a technical, knowledgeable person with differing degrees of skill. Yet at the same time, the practice scenario is somehow, including the the financial literacy related to the way of practicing that is not touched upon in the medical curriculum. So right from that position into the way 95% doctors are into the practice right now, they're not into medical colleges anymore. So in this scenario, I've been in contact with few of the organizations and few of the members, and I myself have put forward Think Hanger, social enterprise and all, and Kiran, Dr. Kam, our Dr. Kam knows about some of the things. In brief, I would like to share an e-grid, emotional grid for improving doctor-public relation. I would like to stress that doctor-patient relationship is strained but intact. There is upside, there is the conversation that is happening, whereas compared to 30, 40 years back, the doctor-public relation is fractured. And it keeps a scenario of accident to happen at any time. It's like mismanaged traffic and the mismanaged road, potholes, uncared banking, and all those things with all rapid urbanization development with two-wheeler traffic mixture that predisposes to accident, even in spite of different regulations and speed controls, speed breakers and everything, all the individual measures will fail because the whole scenario is poised to precipitate into an accident at any time. So last 3-4 decades, we've got certain situation where doctor has cut off from, as an individual, as a professional, has cut off from the societal plane. So that caused certain fractured relation. I just share one grid and one word about each box, and these are all indicating problem as well as solution also. And then for the other speakers to continue on, and as and when a question comes, I'll be happy to elaborate on any of the point. So I appreciate the earlier doctor, cardiologist and IMA. It's a double role, technically attending work and also organizational job. And Kiran for taking initiative for this. So this is the grid I would like to share. So I'm calling it e-grid for improving the doctor-public relation. So on one side is the doctor, the sections, doctor and the rest of the society as an individual and segment, and what are the emotions about self and about others. For example, doctors, with all these attacks happening, they are feeling self-pity. Why did I become doctor? How did I become doctor? I put so many years of, I'm looking at the emotion component. When emotional components we address, we develop empathy, and then we can revitalize, make the position for a solution. So the law, there are laws, but in implementation, some laws may not be implemented in time. Which may cause a huge scar for the individual doctor and create panic in the entire doctor's fraternity with the social media and all. So doctors, as I see, are feeling self-pity about themselves. I have done so much of work on becoming a doctor specialist, sacrificed so many things, whereas public don't seem to acknowledge as much empathy. So what you've done? So I have done accountancy, someone has done engineering. For where I have come, value for money, value for attention time. Why, how this has come is a different scenario. But this is the emotion, self-pity, pity about self. And then bitterness about everybody, including the patients, including judiciary, police, I name any section. So if, as a service provider, if the service provider is upset with the client, then how can there be an improvement? Rendu chappatli rendu chetulo vastene sound vastundi. So there, the breaking down has reasons on the doctor's side, which is in our hands, so to say, doctor's hands. It has certain facets in the society which we need to do. So among the public, as an individual or as a society, if you ask anyone, do you want to go beat any person? Doctor may be the last person. If they say, they may want to go beat so many of the politicians, criminals, so many things, but they may not dare because of so many reasons. But they may not mention a doctor's name necessarily. But in a precipitous moment, emotional thing, it may become, for whatever reasons, it may become a mob attack. In US, it may be a legal suit, it may be different things in different parts of the world. It's not just limited to India, the whole scenario, it's a global thing. But in India, there is a physical harm, to the structure and the people and the doctors and the psyche also. People feel about themselves in relation to medical scenarios, helplessness. They cannot help solve themselves. And they feel helpless because of suddenness, because of the financial unpreparedness. So we require certain solution for that. And then towards the society, everyone is feeling a bit lonely, and that alone is a personal choice. That loneliness, the earlier large umbrella of the extended family, cousins, uncles, mamaya, babaya, all that is not there, and colleagues also only will come in the evening to visit by. So from the society side, that which was there, the backup, the social security, the kind of thing, that suddenly has missed, and India hasn't caught up with a new model. We cannot ape UK model or US model. They have their own heritage and places, the kind of thing. So we need to evolve a new social fabric. So just to say, solution part to each of the components, and these solutions will go a long way in managing an accident preventable zone, so that all other legal measures and everything will be deterrents, different measures. For the self-pity, we need to empower all the doctors, medicos and doctors on a fast track basis on general management. It is possible. And then regarding the doctor's impression about all the public, there are no spokespersons for doctors. So all doctors individually or in groups or associations, IMA, our previous speaker has mentioned, we all need formal training in public communications. All doctors are trained in private communication, one-on-one communication. But on mass communications and social media communications, programs like this and the members like RKB members and initiatives like Kiran and so many others, and Think Hanger is there. So the public communication, the communication management training for all the members, especially organization related members and organizations becoming professional bodies employing management people. So that improves communication rather than feeling bitter about the society and judges and police and everyone and the media. And in the public, that helplessness must be solved strongly by evolving a clear and a stronger medical insurance system. Once that is taken care, when it is needed, if the that financial strength is given, there will be so much of removal of altercations and anger and bitterness, suddenness, so many things. And at the public level, if an individual is sick, there were a lot of members to help in support and everything. We need to get into something about total recovery, about rehabilitation and restoration. Those measures need to be. Now with the digital, perhaps many of these things also are possible. So within the public, if these are done, those emotions will not become anger, angst, kopam, teliyani kopam. These will not become into those. Whereas from the medical side, if we address these two emotions and solve, doctors individually, group wise, professionals wise, organizations wise, they will become stronger to address the problem. Why the problem has come, has got an evolve. If time permits, we can get into that. I can share my view. But having arrived at the problem, we need to address the emotion points so that we can go ahead and develop empathy in a practical way. Let's prevent the accident proneness so that we can solve it. All these are solvable. We can employ management campuses to do the work for us. We can employ professionals to do the work for us. We know what to be done. And regarding the government side and everything, we can enhance, accelerate the demand by joining and writing letters and everything we can do. So doctor public relation is where I want to stress, so that the scenario is not accident prone. That's the thing. Over to the room. Any questions regarding that at any time? I'm happy to answer, and I'm continuing works in this direction also. Yeah.
Thank you, sir.
Thank you.
We appreciate that, and then I appreciate the chart. That's very nice. Lakshmi Devi, you want to go ahead?
Yeah. Thank you, Kiran. A very good evening. So I'm happy to be a part of this. Actually, I am a gynecologist practicing at Rainbow Kondapur, Hyderabad. And being a gynecologist in practice since 2008, I am actually afraid to practice now. Okay, the main reason being that it has become very, very insecure outside. So the patients who are coming, we have to look at them in terms of, is this a potential medical legal case? So every patient is looking as if they're going to create some nuisance. Okay, so the very charm of that empathy and that feeling of service is coming down. That's because of these kind of issues which have come up in the past. Always the attacks on doctors were there, but now, since the onset of the pandemic, we have seen that these have escalated tremendously over the last 1 to 1.5 years. So I should be telling you that I'm doing my LLB course additionally just to keep myself safe, okay, just to know the rules. Okay, so I think that every one of us should know the rules and how to defend ourselves, because these were not taught to us in the medical school. And basically, we are more concerned with the clinical aspect of it and also with an emotional aspect, as Dr. Gopichand has put in, that we are more concerned about treatment of the patient and their well-being rather. And this kind of abuse in terms of verbal abuse or physical violence is really, really not warranted. As Dr. Kiran has put in the introduction, it is not warranted at all, because it makes us feel insecure and it makes us feel something against the society, the bitterness, as Dr. Gopichand has put in. So what is this? I mean, why is it going ahead? This is because the family, the patient's family and the society at large, it's not a one-pronged approach, as Sir has told. We have to act in terms of the society, in terms of government and their policies, and a strict law in place. Okay, so obviously the financial situation and the infrastructure of our hospitals, I mean, more of the government hospitals are not at par with what they should be. And considering that 1% GDP is spent for health infrastructure is very, very poor. So considering the overcrowding and the inattention to patients, the attacks have increased on the doctor who puts up the forefront there. Okay, so considering all these things, it is not a problem of the doctor alone. Okay, it is a problem which has to be approached through the government. And also the laws have to be more strict in place. And there is, and the health being a state subject, there is no central legislation to help us. And as Dr. Karthik has put in, IMA is doing a very commendable job in helping the doctors to stand on one platform and protest against these attacks. So I think we all should be one in order to fight these kind of attacks and stand for ourselves. Thank you, Kiran.
Thank you, Lakshmi Devi. Very strong points made in just a couple of minutes. Obviously, she's our class topper, and we used to be scared to compete with her. So now she's doing law also. Very good. All right. So who wants to go next? Niranjana Garu, you want to go next? Yeah, unmute yourself, sir.
Yeah, good evening, everybody. Am I audible, sir?
Yes, you are audible. Please go ahead.
Thank you. So, very happy and highly privileged to be associated with all of you as stalwarts, doctors like Kiran, Gopichand Garu, Manoj Garu, and all my colleague advocates also appears to be here.
Niranjan Garu, namaste. Good evening. This is Jayanti Andi. We met at Rainbow.
Right. Guttupattanu only. Thank you, ma'am. So very nice to be a part of this program, and it's really an honor and a great privilege to talk and listen from a great doctors about the injustice caused to them because of the mob and unruly behavior of so many patients. To add to this, my view was, after the lapse of the family-doctor relationship, earlier when we were as a child, we used to go to a family doctor who alone used to treat the entire family. So when the tradition continues, according to me, there was no such kind of violences and other things. Of late, this issue has become more dangerous. And for every small thing, the people have become violent and used to create a panic and hurting the doctors, and even it going to killing of the doctors, destruction of properties of hospitals, cars, everything is happening across the country. And more particularly, I'm sorry to say, in a particular set of the people, this damage is more. You are creating, particularly like the old city in Hyderabad, this is creating a lot of problem according to me, and more cases are reporting from that place. So even though it is a phenomena across the world, as rightly pointed out by Dr. Kiran, but it is encouraging this kind of thing is being encouraged because no proper law has put in place because of the government's failure. I came across only in 2020, there was a central government ordinance now in Epidemic Diseases Act to protect the violence against the doctors and the paramedical staff and also all the health care officials. Only in that ordinance now some kind of protection is given. It is become a non-bailable offense, and the courts are also expeditiously to dispose these issues, and then the compensation can also should be awarded to the victims in cases of any damage to the property. So all these things are recent issues in 2020. So earlier one proposal which was made to make a particular law for the protection of the healthcare officials was dropped by the Home Minister, because on the ground that these kind of offences are already protected under IPC, no need of any separate enactment for this. So this kind of the attitude of the government also is not helping the healthcare professionals to protect for themselves from this kind of unnatural violence. When the doctors are treated as gods next to the parents, so when the gods are being penalized or hurt like anything, it is very unfortunate that the government has not come out with any proper law. And the laws which are now in force also is not sufficient to protect the healthcare officials as it in place now. In the police also not able to register the crimes, under what section it is to be registered. So that is a kind of a method to avoid the registration of the offense, or ignorance is also an issue for most of the police officials, not able to register the offenses against the doctors or healthcare officials. So therefore, now as IMA and all of you should take it more positively and more vigorously to convince the government to make a perfect implementable law which protects the healthcare officials from these kind of incidents. Therefore, my point is all of you should work together more vigorously, and you should more forcefully, the central government should be convinced to pass a law on this subject. That is my view, sir.
Thank you, sir. Thank you very much. We need people like you with great experience. And yes. I believe Ramya Agasti wants to go next. Ramya, please go ahead.
Yes, sir. He was pointing the right things to speak in the right time. Dr. Niranjan Garu, you gave the right words in the right time. The reason that I wanted to point here is the family doctor thing which you have said. Actually, when I remember my grandmother used to go to a doctor, and whatever he gives, it no matter it's a homeopathy pill or something, she feels that she's cured totally, and we feel him really like a god in the family. Like you meet him, you get it done happily. You come out smiling and happy from that, no injection, nothing. But he knew how serious the things was. He used to convey the things in the right way. By the way, I am Ramya Agasti. I'm a psychologist and a journalist too. So in this whole panel of the people, I would be one person who would be standing from the side of people and from the side of the doctors community, also from the healthcare community. That's the right word I should use. So my intention to talk at this moment is making laws, doing great things is one big thing. We all are supposed to clock in to do it. But before that, there are some little things which we have been missing in our own hands. Like the corporate system has come. There are many huge hospitals, corporate, which have come like 5-star hospitals, where the communication to meet the doctor and get the right information is being stretched in a very long way. Previously, like Dr. Niranjan said, I can easily go and meet my family doctor and ask him what has happened to me. Will this pass on to my next generation? And answer is very clean and face to face. But now, to meet a doctor, it is like a simple saying, Tirupatilo Venkateswara Swami ticket and a special darsana dorutundi gaani mana hospital or doctor garini kalavalante. It is a very big chain of process, and we only have few minutes to talk to him. And people are almost scared to talk to him and ask their doubts. Anta takku vyavadhilo anta rapport doctor gariki ivvadaniki వాళ్ళకి కావాల్సిన డౌట్స్ క్లారిఫై చేయడానికి ఒక చైన్ మిస్ అవుతుంది. దాని వల్ల ఏమవుతుందంటే ఇన్ఫర్మేషన్ ఎవరికైతే ఎక్కడి నుంచి రావాలో,
English please, because I think we want it to be a national audience.
People who need to get the information, like who is scared, like family person who is attending them, they need to get some all basic doubts and information clear. It is only been cleared in a very fraction of time which they expect it a little more. And the people they meet usually are front end, dusk people, and a few of the nurses would answer them if necessary. Rarest of the rare time they talk to their doctor. So this gap is allowing them to think more about the trauma. Actually, if somebody says, if a family doctor says the only 3 months chance is there for someone to survive, they would take it in the right way and do measures. But if that answer is given by somebody from a corporate sector or from a far person, they can't take it easy. I know they have plenty of options to choose also, second opinion, third opinion. And if the answer changes, they are not able to digest it also. That is also okay. People can also take it happy. But there are great people who are good and who gave their personal time to the society. There are few businessmen involved in this also. So I wanted to be a little more easy. If goals of the doctor and goals of the hospital are both the one to serve somebody, that is a good journey. There are some situations where we have seen in the recent times, the COVID time, basically, the most of the complaints we listen from the regular crowd, they say that I didn't expect that my 4 hours of time spending out there made me spend 2 lakhs. They would not even have the knowledge of how they're going throughout it. How there are few doctors like Dr. Kiran, many other people who didn't even charge a penny for their great advice. So there are different. Let us not talk about only of one side of the coin. Let us handle how we can prevent it and how we can make it easy also for other people to not pass through this journey. First is communication between the patient and the doctor to make them understand. Second, to not get it repeated in whatever sector we are, either it is a small hospital or a huge hospital, whatever it may be, that is also is important. And there are few more points I wanted to add in this. Family members are now getting so much of information from the internet, but that doesn't mean that's a true treatment for their condition or not. At this particular point of time, they need somebody to counsel them in between. Need not be a doctor, but there can be somebody from the same hospital or the team to educate them in a right way. May not be doctor he can't sit for hours together with one particular patient or client, but the chain of it is missing it. That is which has happened with the family doctor. That is what we've been missing here. This is the one great point I wanted to address along with Dr. Niranjan sir here. And the legal things, why we have also spoken, beating the doctor, hitting the doctor. Doctor is the last one to remember to hit in the life. That is the right word. Nobody wants to hit a doctor, because after the parents, everybody love their doctor because he know how to help you. But if you ask every individual separately and ask them, if you're given a chance to blow somebody, who would be in your hit list? There might be a dentist who pulled your teeth in a wrong way, which has suffered you for more than years. That is for sure. There might be a doctor who couldn't recognize what exactly is going through in this body. There might be a doctor who somebody did not allow them to go for a second opinion and made him sit. And there are some prejudices that have been listening from the news and media, like we have already seen the Tagore movie and many other movies. Even they keep giving the treatment on a dead body. And these are the things so many of the people have visualized and liked themselves. Some few hospitals also, unfortunately. So here, for me, beating a doctor is the last thing. A good practitioner and a business practitioner. Because when money is not involved, family doctors, their money is not really a first point for them. A rapport between the family was the first thing for them. Because from the ages, all the 3 generations, they've been with the same doctor. But in this corporate sector, here money is involved. When money is involved, it is he's almost a consumer kind of person. Maybe Krishna sir, you're going to be the right person to talk about on the side of consumer or on the side of the patient side also. Because there are their problems also to be addressed. If both of them, because it is a journey of the patient and the doctor together. If one is missing, the other is not there. So both of them should be happy to make their journey in a right way. So let us design some basic things which makes things in our hand comfortable. Let us all flock together to design some great things so that everybody, even if some patient is being wrongly treated or highly charged for the basic things. We have heard few hospitals in Vijayawada are charged by the Supreme Court because they have charged beyond the limit of the government thing and more than exceeded. And so some wrong practices, malpractices were happening in their hospitals. Not just Vijayawada, it has happened in all other places. So I have witnessed it personally. So I could speak about it. That's the only thing. So this is all about it. So let us repair these things from the initial side of the patient and the doctor relationship, and the communication between them should be as minimum, as straight as possible, and it can equally be solved in the right way. Message should be passed. If at all it's a serious or wrong thing, that is also should be passed, and the communication, as Gopichand Garu said, should be given in a easy and right method, so that they love your answer, respect your answer, understand what treatment is going through with them, and then believe in it. Because most of the time cesarean doctors, we always say that most of the gynecologists, they do cesarean for their benefit. No, it was not the same. But that by patient and attendant should be educated why she needs a cesarean. If that why is not answered, there is always a gap. So please look into why this is happening, then we can find nice answers. Thank you, everyone.
Thank you, Ramya. Appreciate your comments. All are well taken. Very good. I think we have Mr. Manoj, Mrs. Jayanti, the panel members still to introduce themselves. Whoever wants to go first, please go ahead. Manoj.
Yeah, could you?
Yeah. Madam, go ahead.
No, Mr. Manoj wants to talk. I have no issues.
Okay. I think he has not unmuted himself, so he lost his chance. So you go first.
Oh my God. Okay. Yeah.
Okay. So good evening, everyone. Thank you, Dr. Kiran, for giving me this opportunity to be part of this panel discussion on the much discussed across the globe, that is medical legal issues, and why the doctors are being manhandled or mishandled by the public at large. I think I have witnessed on both the sides. Like I am one of the victims of medical negligence of a hospital. I do not want to take the name, by which we lost our father, who's also a senior advocate in the bar, AP bar. At the same time, I happen to be a legal consultant to one of reputed hospitals at Hyderabad, that is Rainbow Children's Hospital. Initially I was an employee, now I moved out, and they requested me to continue as their consultant, medical legal consultant, which I'm doing right now. So what I have witnessed on both the sides, like as a patient or a patient relative, as well as a legal consultant or associate with the hospital, I just want to share a couple of issues rather candidly. As rightly said by Niranjan sir and other doctors, like initially we used to have this family doctor concept, which as such, as on date, is totally eradicated, or it's no more in place, that concept of family doctor. Even we used to have a family doctor for the past 30 to 35 years. My parents, especially my mom, even today, she believes any issue and any problem, whether it's to pulmonology or BP or any other issue pertaining to her, she first calls him. So then she goes to, basing on his advice, she goes to the referred doctor or referred specialist. So that's the impact the family doctor has got with initially, I mean, the olden days. Now, as we have observed that concept of family doctor is no more in place. Mostly, I mean, on the scale of 10, we see only one or two cases. Second thing is, what I feel is, in addition to not having effective laws in place, why this gap between the patient and doctor has increased to such an extent. Now it has become irreparable gap or unbridgeable gap. Number one, what I have observed is the corporatization of medical profession. It is no more called as a noble profession. It has become more or less a corporatization has taken place, and it has become more of a business parlance rather than a individual touch or that noble profession tinge. Why only doctors, even lawyers were being attacked, even in Hyderabad very recently. Lawyers are being attacked, judiciary is under attack. You know, social media is playing such a great havoc thanks to it. Even before the judges are taking up the cases and hearing the cases, social media is coming up with the judgments, with their own opinions, which under legal parlance have no nexus at all. They don't know the facts. They don't know what the law speaks about. They just comes out of emotion. And no less than the Chief Justice of Supreme Court of India, he himself lamented very badly recently, saying that, I mean, if the public is attacking the judiciary, where would judiciary would go? Or where would judges would go and talk? We don't have any protection. So
Very
that
sad,
is a
very
solid
sad,
state of
very
affairs.
sad, very sad.
So
I want to
I
say
think
this.
personally, social media is playing a great havoc. And everything is available on Google, most unsolicited information, either it's medicine or judiciary, legal related issues. So my dad always used to say, two things are very easy for people to talk. One is medical, other is legal. Everybody is a doctor, everybody is a legal expert.
Yeah.
So most of the I see lots and lots of unsolicited information on the Google, thanks to it. Which, if we go in depth, there is no. I mean, I said there's a lot of insanity happening on this social media. Insanity.
Yeah. Yeah.
Other thing is, it's not just the laws should be really effective enough. Before that, why this is happening? So any patient, any person goes to the hospital or doctor and they want to get treated properly. The second thing is they want to get cured.
Yeah.
No matter what's the disease all about, no matter how much they're affected, no matter how much deteriorated stage it is, they want to get cured. When that's not happening, emotions come into place. And second thing is, people, the number of people going to the government hospitals have reduced, and going to the corporate hospitals have increased exponentially. Now they are seeing, I'm paying so much of amount, so much of money, and I expect health in return from the hospitals. So this is give and take.
Right.
So they are coming with they are going to the hospitals with a preconceived notion that if I go to a corporate hospital, the best hospital in the city, I should get the best of the cure. Or I should be cured. That's it. There's no other discussion on it. However, the doctor explains how much of informed consent they take from the patients, how much counseling they give, the doctors give or the counselors give. End of the day, the patient wants only cure from the doctors. Yeah. And that too, when the money has become a component, an important component, an indispensable component, then all these extraneous things like violence, attacking the doctors, attacking the hospital property, damaging the assets. I have seen myself evident to many this kind of, I mean, unruly aspects in the hospitals.
Yeah.
Yeah. So what I say is, there's a lot. It has become an unbridgeable gap between the patient and the doctor. For various socio-economic and media, I think that media is playing a great havoc. So media is the biggest culprit. Second thing is, people are getting so much of information in various ways. As I said, the media. That is one thing. And of course, now what I can say is the courts are really proactive, and we have category of judgments wherein the National Commission or the Supreme Court or various other high courts have come down very heavily on these attacks on the doctors. Either it's a negligence, whatever it is, doctors are to be protected. Doctors are to be protected, and we have systems in place. If a patient is not happy with the treatment, see, first of all, neither a doctor nor the hospital pressurize or force a particular patient to come to their hospitals. At least to that extent, we are still maintaining certain standards and norms. Patients having decided to go to a particular hospital or doctor, number one, what they have to have, we should have this trust factor.
Yeah.
Trust factor.
Right.
And that kind of education should happen, that doctors are not gods. We have catene of judgments where the courts have come down very heavily, saying that, making it very clear, doctors are doctors. They are just human beings like you and me. They are not gods.
Yep.
And it has come, I mean, courts have interpreted the law saying that on medical negligence, what is negligence, what is gross negligence, what is error on judgment, whether informed consent is mandatory or not, what will happen if informed consent is not there, in case if a death happens, how to handle that. So all these things, courts are being taken care of as and when they are getting a case on medical legal cases. And most importantly, the number of cases have increased exponentially. You know why? Because doctors have, the healthcare has come under Consumer Protection. And for Consumer Protection Act, a case we file in consumer courts, we don't need any court fee to be paid. There is no court fee. So it's very easy for the people to approach the courts and file spurious cases, at least on a scale of 10, at least 4 to 5 cases are spurious cases. As such, I myself is handling almost some 10 to 12 cases in Hyderabad and some 5 cases in Bangalore. Few went to the extent of police station because death happened. And if you know, when I came to when the case was referred to me in Bangalore, prima facie, as a lay person, I thought that is a pure negligence of the doctor. But when I went to the entire medical history, when I heard the narration from the doctor, when I appeared before the medical associate, medical council, I understood that actually there's no negligence on the part of the doctor. That was my candid feedback I've given to the hospital. So likewise, it's not that every time there's a negligence or doctors are at fault. At the same time, we should also see the other side of the coin. There are cases because of the corporatization, wherein I mean, the other thing is media. We have movies. I mean, they show as if doctors are pure villains, which is not the real case. Either the COVID or sans the COVID, also doctors are playing a extremely excellent role as doctors. Only thing is that, as Ramya said, that link is missing somewhere. Today, to the hospitals, what we are advising is have an SOP in place. Put a notice at the conspicuous places. Have a board, a notice board, where a display board wherein it clearly speaks that, or I mean, it's a knowledge to the patient or information to the patient, like what are the do's and the don'ts at the hospital premises. This indeed we are doing in Rainbow hospitals. We have a clear-cut SOP. What are the do's and don'ts, even at the time of counseling, how the doctors have to address these people or attend this kind of counseling patients. And second thing is, once any kind of attack happens or any untoward incident happens or any violence happens, what are the immediate things, the precautionary things the hospital has to take care of? It is a predominant duty of the hospital to take care of the doctors and their interests. Of course, in addition to the insurance part, the professional indemnity insurance part, in addition to that, doctors have to take care of the, the hospitals have to take care of the doctors.
Yes.
Law comes next.
Yeah.
So at times we take support of the police, because when the mob is unruly, very recently, like a baby passed away. He was on his deathbed. He came in the last stages. Doctors advised that the baby might not survive, and within no time, a mob of 50 to 60 people have come down.
Yeah.
Immediately we had to call the police, and of course, in the meantime, we have a complete trained team who is trained to handle this kind of mob, to pacify them, to talk to them. First and foremost is talking to them, have a proper communication with the patient relatives, because their emotions are very, very, very high. Because I'm like one such relative, because when my father was hospitalized, even we had to shed almost some 15 to 18 lakhs in one of the corporate hospitals. Till the end, we were not known what exactly is the problem with my father. He suffered for 2 months. And of course, our emotions are high. One is the patient's health getting deteriorated. Second thing is our money is getting involved in it. Our monetary resources are getting drained drastically. Almost on a per day, we used to pay some 75 to 80,000 per day. This happened almost 13 years back in one of the corporate hospitals.
Yeah.
So definitely our emotions would be high. At the same time, so as I said, the communication should happen. And the hospitals should take care of the doctor's interests. A strong SOP should be there in place, and a proper and effective trained team to handle the mock.
Yeah.
So that's all I can say from mine. Any questions or anything you want to add, or you want to counter or further add to my points? Most welcome.
Thank you, madam. I think you made a lot of good points, especially there are two sides to the coin always. And there is a lot of emotion involved, finances involved, and then the social media, any negative message spreads like wildfire, social media and the media. Ramya, you'll get your chance. Hold on for 1 second.
That's about social media I wanted to add. We have to be careful when understanding how social media is playing here. It is also a greatest weapon in everybody's hand. Nowadays, if anybody uses it in a wrong way, they are also being charged in a very high way. I mean, they've been given tough punishments for a simple message forwarding also. So everybody should be conscious when we use these words in a sensitive scene like this all. Thank you.
Of course, yeah. So we'll get into more detail about it. So, so in the media also sensationalizes a lot of news depending on what they think is breaking news. So there are so many aspects to this problem. That is what we are getting to, listening to everyone, different experts from different areas of life. And Manoj Kumar Garu, please go ahead, sir. Last but not the least, go ahead.
Yeah, fine. Very good evening, respectable Dr. Kiran, and I'm very much thankful to Nagesh Garu for adding me and giving this opportunity to join in the panel. And I noticed that very valuable points have been so far, highlighted by Niranjan Garu, Dr. Gopi Chand Garu, Dr. Karthik Garu, Lakshmi Garu, Ramya Garu, Dr. Jayanti Madam, and all. And I'm looking for new points to add to the panel now, because what I have thought to discuss, you are already being discussed in this, and hope I am audible to everybody. Okay.
Yeah, you are audible. Please, yeah. Yeah, please go
Previously,
ahead.
Previously, the government, the spending, the healthcare spending is quite, low, and it is around 1% of its total GDP. And even a fact to be informed, it's less than 1%. And I want to convey that, the positive aspects of this COVID, coronavirus disease 19, it made everybody, and it influenced everybody of the society, right from the governments and the large institutions, even the, healthcare reforming institutions, and the bottom line of the society, like individuals and every citizen. It influenced in such a way the health is the prime and the paramount importance shall be given to the health. Right from the hand hygiene and personal protection or the physical distance and all. And it had taught us a lot of lessons in our daily life. And unfortunately, the other side of the coin, when we consider, particularly during the time of this COVID pandemic, every hospital and every doctor were absolutely treated as doctors, as gods. But unfortunately, what happened, the recent incidences in the multiple places of the nation, the providers, the healthcare providers, the doctors, surgeons, the nurses, the paramedical staff have been abused, scolded, beaten up, threatened, whatever the bad society can do, they have done. Unfortunately, what bad is influencing the society, have been propagated more and, more advertised more than what good the healthcare providers and the healthcare system is doing to the society. To be introduced, I'm Manoj, the healthcare consultant, and I have been actively involving in, accreditation and certification consultant to both public and private hospitals since last 10 years.
Yes.
Like, whenever I visit a hospital, I used to notice the display of the various acts that are relating, to the, attacks on the hospitals and the staff working in the hospital. I used to worry a lot, what the benefit they are doing actually, doing to the hospital, because in hospitals we display a lot of IEC material, that is information, education, and communication related signages we display. But unfortunately, very less or nobody bothers about the information that have been displayed in front of the hospital. And there I feel that people are very much less concerned. That is the thing. The recent incidents that have been happening, particularly to hospitals, is is an internal issue of the government, because we are the healthcare providers have been doing a lot of good to the society, and unfortunately that has not been being highlighted. And it is the responsibility of the governments and the society to help and to safeguard the moral and the professional integrity of the hospitals and the healthcare providers that that are contributing to the society. Since I have been involved with certification and accreditation aspects, I feel very much happy if the certification bodies also insists on the measures that hospitals is supposed to take as a part of their daily operations. Prevention is better than cure, that we already know. Even right from the planning of our hospitals, the hiring of our employees and all, we worry about the work that need to be done. That's it. And at the time of planning, we won't inculcate or we won't imbibe the preventive approach. Even if a particular mob or the patient attenders attacks, what kind of approach the healthcare employees need to follow, and what are the physical measures should be implemented, like that, we are less concerned. But right now, it is fine that the new corporate hospitals have been establishing their health facilities with all sorts of all sorts of necessary facilities. I must say thanks to CCTVs first, because they are providing the true evidences. Whenever any such kind of negative incidents and all happening, to the hospitals, and they are providing the right evidence, so that at least we are in a position to defend ourselves. And one more point I would like to add, the hospitals are facing this kind of emotional disturbance or psychological disturbance, not only from the public. Even a lot of rules have been enacted on the provider side, and all the laws that have been enacted and were being implemented, where majority of them were safeguarding the rights of the care receivers. But from the provider and even from the fire NOC or the pollution control board or the the clinical hospital, everything were enacted or enforced to maintain the rights of the receiver end. But unfortunately, if the providers are strong enough, they are in a position to serve the society more. They can influence the society more. Even in the COVID time, we have noticed that we suffered with lack of necessary or adequate facilities to deal with the number of increased patients in the country and even across the globe itself. If the focus was if the focus or the attention was much paid on the provider or the good rights or influencing the providers in a positive way, it definitely it brings a lot of change. In the olden days and in the golden days, the doctor-patient relationship is about the wellness relationship. Now it is not like that. It is the problem relationship. It is an illness relationship. And people or the public or the patients and their attendants who are visiting our hospital, they are demanding quality. It is fine. It is nothing wrong in demanding quality. Even all the providers have been making a lot of steps to ensure the better quality to be given. But unfortunately, they are demanding the life of the patients and, bringing the patient at the last stages of their life, and at bringing the patients to the hospital with high risk factor, and even it is openly, the hospitals itself telling like the risk factor of the patient is high, but at the time of admission the patients and their attendants, they tells that it is fine, it is fine, it is okay to get admitted in your hospital. But once the consequences or the incidents going on, they have been turning into red from green. This kind of fluid behavior of the patients, keeping hospitals and the providers at ambiguity whether to go ahead with providing the better treatment or to halt in the middle, because they negotiate with the doctors with respect to price, because hospitals cannot invest more for the sake of the patients, because of their negotiation. It is not only about the negotiation. Of course, the providers have been making maximum efforts to safeguard the patients, because no provider expects their patients or patients attenders to be, punished or to make them into jail. The hospitals are there to provide they expect the health outcome should be in a positive way, so that they feels happier while they leave. So in such a way, the society have to understand this point, and the whatever the good the hospitals have been doing, it is the responsibility of the governments to highlight, because your private, even though it sounds private, it is not. We are not apart from our country, we are not apart from our state, we are not apart from the government, because we are all, everybody is the citizen of this country, and everybody works for the betterment of the government only, betterment of our state, or betterment of our country only. So it is more of the responsibility of the society and the government to work for the for goodness of the healthcare providers. And regarding in hospitals we usually take during the time of the admission general consent and informed consent. What is happening, even though we notice the recent incidents, negative incidents or destructive incidents happen to the hospitals, there is no role played by any informed consent or general consent, because once the patient is admitted, it shows it is an implied consent that they are consented to have the treatment in the hospital. So in this aspect, now the policymakers and all should look into the aspects, the preparing a registry of the people who are more frequently involving in the activities, that destroys or abuses the healthcare providers, or they can list out the hospitals where more number of attacks have been happening. A particular hospital, they should introspect why my particular hospital, my particular facility have been in the news for a wrong reason. Like that, they should introspect and they should take measures. And because in majority of the situations, majority of the hospitals, the healthcare staffing, is very much inadequate, because it is a global issue, particularly the doctors and the staff nurses or the paramedical staff who are trainees have been posted in their job, and they do lack the managerial skills, they do lack the communication skills. I want to highlight one example. Previously, I think 5 years ago, I was associated with a cancer hospital. And in one day, the hospital decided to make its equipment as a, for preventive maintenance schedule. And at that point, when a patient approached the hospital and approached a particular department for a diagnosis, and they said like in a, vernacularly, they said like, Amma, ee roju machine paadaipoyindi, machine baal cheyali, and like that they said. And the patients in how they communicated, like the hospital, the equipment was all malfunctioned, and they have been doing its operations with malfunctioned equipment, like that. So whenever whenever any kind of healthcare provider or a person or an employee dealing with the public, they mandatorily given a training. a practical training they should be given so that they communicate well to the patients and to their attendants, and so that they better understands their language, the issue or the problem that the hospital have been with, they can understand well, and accordingly they can take a decision. And nowadays there is a mushrooming of hospitals, and the patients are having already better options. They are already having better choice, and they are opting a particular hospital after reviewing 3 or 4 hospitals, and they are well informed with Google, well informed with their natives and all. But when the situation or the situation of life is going worse, and they have been taking very adverse steps, and it is very much unhealthy. And we all know health is wealth, and if we want to safeguard the wealth of the country, it should focus on the health, and particularly health providers. Because as I said in the beginning, prevention is better than cure. We should more focus on prevention. Yeah,
there is a very
you.
important point that you made, that is communication, and we'll get into detail about that too. So I think this is what I think we should do. I think all the panel members got an opportunity to share their perspective, and I think we should invite Mr. Krishna Mohan to actually ask us questions and get to the bottom of these problems. I'll simply say this. I know this is not an easy process. Everyone has a lot that they want to say, they want to share. There's a wealth of knowledge, their experience and all that. And people watching this, I hope they are getting different perspectives from different people, all sides of the coin, not just 2 sides of the coin. We have like 10 sides of the coin here. So that is important. And often to solve problems in life, it takes patience. It takes patience. Everything is not going to be like a Tagore movie or RGB movie where it is going to be exciting. It takes patience, one by one, listening to people, trying to understand. Yes, you may not agree, you may agree, you may be feeling bored. All these components will come. Listening to people, understanding their perspective, making them feel understood. And then that is going to build a platform to actually do a good work in solving this problem. And we have done that patiently for the past 1 hour. Thanks everyone. Thanks everyone for being patient with us. Now, let us get into the details. So, Krishna Garu, please go ahead and you help us, okay?
Yeah.
And
Very good evening to all of you.
Yeah, thank you. Go ahead.
Yeah, I'm Krishna Mohan. I am basically a consultant for various industries for computer-aided design and crafting. I cater to do all engineering drawings for various industries across the country. And I'm also into environmental projects. I'm a freelance writer and a leadership trainer. So that's briefly about me. Well, friends, Dr. Kiran should be appreciated for initiating this wonderful discussion. And all the panelists so far have shared their beautiful thoughts, their individual thoughts. Now I think it's time for us to put together all these things and perhaps maybe further discuss on a few more things so that it will be more fruitful. And since we have the secretary of the IMA also with us, I think we can jot down all these things together, put together, and give a representation through the IMA. I think that will lead to a better discussion. So I request all the panelists to participate actively in the further course of discussion. Before I go ahead with some of the questions that we wanted to discuss, as Dr. Kiran in his opening remarks told that this problem of violence against doctors or healthcare providers is not unique to India. It is spread across the world. That's the reason WHO also has defined the attacks on the healthcare as any verbal or physical attack of violence or obstruction or threat to that interferes with the ability or access to the healthcare. So anybody who obstructs the availability of healthcare also is an act of violence. That is how WHO has defined it. So it is much more than the physical violence that we are actually discussing so far. Even if somebody obstructs or suppose somebody causes obstruction from entering a healthcare facility, that also is an act of violence according to WHO. So now, friends, now since all of you have expressed your opinions on various aspects of the violence and why it's happening and all those things, I think can each one of you in a couple of lines condense this into the reasons for violence? What in your opinion is a reason for violence? Can you just put it in one point or one reason? Each one of you, if you can give one reason why it is happening. Jayanti garu, one reason according to you why violence is happening against the healthcare providers.
High expectations from doctors in terms of health.
Okay. High expectations from doctors, you mean, madam? High expectation from doctors?
Yeah, means like without understanding the gravity of the illness. As I said earlier, without understanding the gravity of the illness, what exactly the patient is suffering with and all, the expectation from the first and foremost, when one reaches the hospital or a doctor, the patient and his or relatives expect cure.
Yeah. So high expectation.
Yeah. So let us, I suggest someone maybe.
Undue expectations, let me say undue expectations.
Undue expectation from patients. And let us actually take notes now. Someone, I don't know who it is going to be, whether it's Krishna Mohan Garu or
Can Naishra Garu help us on this?
So that we make all these points. Now we are coming to, make some points so that it can help us. And let us not repeat the same point. So next, whoever wants to go.
Garu.
So my view was, as Jayanti Garu rightly pointed out, we are expecting too much from the doctors. And forgetting their own strength or forgetting their illness. They are expecting the doctors to treat them immediately, and then the result will be 100% in their favor, which all the times may not be possible because of the medical issues or any other problems. The expectations of the patients are not being given by the doctors because of various reasons. That's not the fault of the doctors. So therefore, the patients are getting wild sometimes, and they are creating a violence part without understanding the actual reason for their problem.
Yeah.
Is there any other point that you want to add apart from high expectations, sir?
High amount of fees sometimes.
Okay.
Good point. High amount of fees. Here I want to.
One more point, sir.
Yeah. Okay.
Doctors are not able to spare that kind of time what the patients are expecting. They are quickly disposing the patients, not giving the sufficient time to understand the problem of the patients. And because of their professional hurry or because of the many of the issues they have to attend, they are quickly disposing the patients without giving the sufficient time to hear their problem.
So high fees and doctors' time are two.
Yeah, high fees and lack of time, patient overload likely.
Yeah.
So I want to invite here Dr. Gopichan to share in 2 minutes what he thinks about what Mr. Niranjan Rao has said. So unmute yourself, sir. Yep.
Yeah. See, it's like the traffic problem in a given city with all proper signal lights and everything. All the traffic perhaps can go in a seamless way to their destination of recovery, joy, happiness. And unless the vehicle density and the road conditions and the road are improved, a best of signal at a particular junction and best of training to be a driver will not change the accident proneness. So unless the doctor-public relation is improved, the doctor-patient relation will not stand as strongly. So now what causes? Two things: an agitated mindset of the harried patient and attendant and group, with unpreparedness for the sudden medical expenses, which pushes majority of members into debt trap. That agitated, disturbed, unprepared mindset on one side is meeting highly technically knowledgeable trained people, but who are absolutely not oriented in general management, who are dismally trained or oriented towards communication management, public level with the media, social media, communications management, dismal. So when these two are there, it's a deadly combination, and once in a while precipitation is bound to happen. If there is one mob attack in Delhi or Noida or Anakapalli or Kerala because of social media, entire medical fraternity at all the places is affected. So it has 4 dimensions. So consequences of consequences. What happens if there is a mob attack? With this, I'll stop. There is physical, emotional, mental, and spiritual dimensions, and there is collateral damage. Physical damage, so that members can prepare for each of the damages at the preventive level, at the treatment level. So there is damage to the physical harm to the structure of the hospital and to the people. And then there is emotional aspect. Dr. Lakshmi has mentioned about fear. So the fear causes delays and diagnosing, erring, so many things. And fear affects the family and the friends, and it in turn affects the quality of the practice. Then there is intellectual damage. So more and more mob attacks lead to what is called defensive practice. So doctors will not dare to go at the border level, go that extra step into exploring, take the risky cases, cases in high risk. They will just refer, do the first aid and say, go to higher center, higher center, higher center. So it will lead to what is called defensive practice and increase in the investigation burden. For every decision, one has to have an evidence of a lab report kind of thing. Even a 10 years practice, 20 years practice, a doctor with that kind of practice, if he also has to have some documented evidence to show some prescription, that adds to the investigation load, time, cost, expenses, and medical economics. And then there is spiritual dimension. So the relation in the social fabric as a doctor need not be a god, but the act is godly. So the relation of caregiver is, even if it is a consumer based, it changes. And there is collateral damage. If there is in a given hospital, because of a patient mishap and everything, one attack is happening, the rest of all the patients and attendants, their all plans of recoveries, treatment, surgeries, discharges all get disturbed because of this attack. So the entire patient group in that hospital nearby are also affected, not because of any of their things. They get discharged, all the paperwork, everything. So that adds to 1 day extra cost perhaps for all of them. And the staff, nursing staff, will discourage them from going to that hospital or any hospital for some few days. They need to be provided some escort even to come to the hospital. So the collateral damage is even much more. And the extended damage because of social media communication, creating all these 4 dimensions across the nation, will add to the burden of cost and everything. So claps the agitated mindset, disturbed mindset with unprepared for the suddenness on one side, potentially and really throwing people into debt trap on one side, meeting gap in communication management and general management skill in a highly technically knowledgeable, skilled people. That is a dangerous mix to produce precipitation. So we need to work on these 2 issues to improve the scenario. Then if it happens, as Dr. Lakshmi and other members are doing some law, she may have a wonderful alternate career as advisor doing workshops. I invite her, and Dr. Kiran is doing such a wonderful job to spread the medical legal awareness, orientation, sensitization. So there are alternate careers for many doctors who choose to sensitize such members. So every challenge also is an opportunity. So if the legacy is given as this scenario, let the members now give a wonderful scenario, solve this scenario, and let other members have other challenges. Yeah, over
A
to
lot
the
of
room.
good points made. A lot of good points made. Of all the things that really, a very strong point is the collateral damage. People may think that going and attacking a doctor or a facility is going to solve their problem, but actually it is actually creating more problems, not only in one place, but everywhere else. I compare this to COVID cytokine storm. So in COVID, what happens is there is a virus, and in most people, what happens is our immune system just takes care of it. It's done. 90% people, they're just fine. In some people, what happens is our immune system overreacts. There is dysfunctional reaction to the virus. And that is what leads to this COVID cytokine storm, where instead of sending 10 police, it sends 10,000 policemen and everyone starts shooting everyone. And then there is a big problem in our body and people die. The same way in our healthcare system, we can compare this reaction, this mob reaction happening at one place, and then it is spreading all over the country because of social media or even the general media. I'm not trying to denigrate whether it is social media or general media, but sensationalism is what people want to catch on to. No one wants to watch an award-winning movie. Everyone wants to win an action-packed movie. That is how we human beings are. We want that sensation. It is not just media's fault. It's just not social media's fault. Those are just tools. They're only showing us what we want. Social media and media are a reflection of what we human beings are. It is a reflection of what our society is in the current state of mind. So we should not only tell the media and social media, stop doing this, but we should tell ourselves what kind of person I am. What are the things that I want to do? Right? And how should I react? Okay, let us move on to the next person.
Dr. Lakshmi, would you like to add something to this?
Sir, actually everything has been well said. And
in your opinion, what would be the one reason or two reasons for provocating the violence?
Sir, according to the present status, doctors should also learn to save their skin as well, for the doctor's point. And for the patients, one thing is financially and awareness about the medical condition, about their health condition should be brought to the ground reality. Okay. So they should keep in mind that if they are sick, they are sick. And if they're going to die, they should accept it.
So you need to create awareness. Lack of awareness is a problem which is causing violence, according to you.
Yeah. And
lack of proper awareness.
Doctor is not a god.
Of course.
Yeah.
I want to say something here. Lakshmi Devi made a very good point. Yeah. It is about sometimes you are sick and you may die. And a lot of times people have so much difficulty accepting death. And of course, I will have the same difficulty accepting death, everyone, because we all fear death, right? And how do we bridge that gap is a question I think we need to address in our Indian medical society, in our Indian society in general. There are 2 points, because, you know, I practiced in India for a while and then I came here to America. So I kind of seen both sides. So I want to share something here. The fear of death in America, no one wants to die. And I think same is true in India too, right? No one wants to die anywhere. So, but in America, we have what is called palliative care, hospice care. When we believe that the patient is not going to recover, we have a support system. We have support system. We call the palliative care doctor and then, or the palliative care nurse, and they come and they spend a lot of time, an hour, sometimes 2 hours, sitting right next to them bedside, which unfortunately as doctors, we don't, because I have 20 patients to see waiting for me. I can't spend 2 hours on each patient sometimes, but that time is required. That time is required. That support system is required for patients. And we do a good job with palliative care. I think that is one thing that India needs to consider, palliative care, hospice care. On the other side, I also have to say, our Indian people are far better in facing death than Americans, because we believe our land is a spiritual land. We believe in reincarnation. We believe in God. And we have so many ideas incorporated in our culture that gives us solace in times of difficulty, in times of facing death, these kind of things. So let us not undermine our people's ability to face death. Yes, they are doing what they can, but let us also bridge that gap. I think this is one message I would have for Dr. Karthik, to carry this message through IMA to even higher officials to address this issue. Dr. Karthik, you want to say anything about this?
Yeah, I have a lot of things to say.
Yes, please.
So I've been listening, and there has been a talk about family physician and a lot of people missing that. And but that is not the system that's going to be in the future. Let's get to the point of it. Because in our system, we have made so many laws that we don't practice that kind of medicine anymore in India. A family physician used to treat earache or kind of CSOM or ASOM previously. But now, if you treat it, and you can still sue the doctor there. And there are a couple of, I think recently, there is one case which came up with an old patient being treated by the family physician for a earache and then some kind of ASOM, and that went wrong. And previously, all of us know that MBBS doctors used to even do tonsillectomies, hernia repairs, and various whatnot. So recently, we had another case that herniaplasty was done by an MBBS doctor, a good old timer who had done probably more than 10,000 of them, and still patient went on to sue him. So these kinds of things are happening, and nobody is going to be a family doctor anymore. So this is the fundamental that all of us have to understand, that none of the MBBS doctors are going to be family physicians anymore. So because people expect a kind of level of care, because we have diversified in medicine, like in cardiology, we have so many subspecialties coming up. And as medicine grew, and we tend to identify a lot more complications, a lot more issues, a lot more new diseases to come up, and the ways to think and deal with it. So we have a couple of new drugs in cardiology, so people might not even know what they are about. So things are at a different pace. So we don't, something called macicamtan or something like very difficult kind of drugs that people can even talk about routinely. So if you talk about medicine, it is going to be evolved into specialty practice. There is no doubt about it. And though family physician is going to be an old-time story, now we'll have only physicians who will probably take over the place there and probably treat as a physician-oriented treatment rather than a family physician, because they're going to ask for a lot of cross consultations. They're going to ask for a lot of investigations, because most of them feel that it's going to be a defensive medicine, that what we are going to practice from now on. And secondly, there was a question about what is the root cause of it. I would divide it into two different.
Dr. Karthik,
yeah.
Dr. Karthik, I want to reiterate a point that you said, and then I will, you can go ahead with the second point. The point that he said is something very, very important. The times have changed. Medicine that was practiced 100 years ago is not the same medicine that is being practiced today. The expectation that people had 100 years ago is not the same expectation that we have today in this society. And it is because of change. It is simply because of change, and change happens. And the amount of knowledge a doctor these days must have is far more than the knowledge the doctor 100 years ago supposed to have. Like, because there is so much new information coming out, so many journals. Just take COVID. There are at least 1,000 journals published on COVID in the past 1 year. Where will a doctor will have time to review everything of general medicine, a general practitioner, and also have a robust practice. So there is a lot that is happening. There's a lot that is happening, and times have changed. And yet, I would say this point here, even though the family medicine or family doctor may not be able to solve all the problems, I think one thought to consider is having a point person. Maybe he can refer to everyone else around, and then he becomes a point person. That is one thought to consider. Yes, Karthik, please go ahead. But this is a very important point that you made.
Yeah. So as COVID times in the last 1.5 year, we have seen physicians playing a major role in treating the people. So that is a major, I would say, an outcome of COVID that the medical fraternity should be happy about academically. So the next point that I was actually pointing out is to the accidents, or probably the various kinds of mob activities, whatever you want to call them as. So these are predominantly private and government. So private are predominantly because of financial issues. And if you go to government, and it's predominantly because lack of facilities and doctors' communication, because you're going to treat because I've worked with government. I was an assistant professor of cardiology for some time, and I was the only cardiologist for 3 districts in the place. And I've been experiencing that part as well, and I've been in private for so many years. So, and I feel it's more financial issues in private setup, and it's going to be more of a facility oriented or lack of communication, because you need to see, it's like 100 patients sitting in the OPD for a government setup. So it's something that we have to divide private and public. So if you talk about private, it's more financial. So you just cut the finances of it, you're going to have very least problems there.
You're right, Dr. Karthik. I would like to just add here. Yesterday, when the Chief Justice of India was addressing some meeting, he very sharply reacted on the same point, saying that when there is a lack of facility, you cannot go and beat up the doctors or any healthcare providers. Suppose it is a government hospital or any public hospital, as you rightly said, where there are lack of facilities. Suppose there is no oxygen, there is no ventilator or something. People just cannot become violent and beat the doctors, which is absolutely wrong. And similarly, they are beating up the nurses or whoever, any healthcare provider that they are coming across. This is absolutely wrong. And the Chief Justice of India has condemned it very, very thoroughly. And they said they're going to take up all these cases very seriously after. Similarly,
so
in the private sector
as
also,
you rightly pointed, yeah, sorry.
yes, in the
As
private
you
sector
rightly
also,
pointed out, I would like to quote the incidents in Tirupati. Tirupati ran out of oxygen
yes,
just for 1 hour. The vehicle came just 1 hour late, and there was a lot of issues made up by the family attendants just because of the late arrival of the oxygen mission, and 18 of them died. There is a death, and all of them are very high flow oxygen, and accepting death is what people don't really still have it. See, as we have been trying to solve a lot of problems, and government is also trying their best to do it, and people should understand not everything is possible, or death is inevitable. That is what people have to really get it. Death is inevitable, and whoever జన్మించినవాడు ఎవరన్నా సరే మరణించక తప్పదన్నట్టు. So that is the quote that everybody should have it, and I am ready to die tomorrow. So that is how I live, and people all should do it. That is what I tend to tell. Yeah,
acceptance.
I have a point to make here, because death is a topic that keeps visiting us. So I would like to say a point here, and I want to take anyone's response to this question that I'm going to ask. Now, I'm taking the role of a patient's advocate, not as a doctor. Okay. So what happened was, approximately 1 year ago, last August, my very close cousin, his father, who is around 70 but healthy, in good condition, Of course, he had history of diabetes. He has history of hypertension. They're being controlled well. And then he also had a history of cabbage, which is surgery for his heart. Now, that was long back, but he has been doing well for almost 10 years. And his regular last echocardiogram was fine too, just a few months before, 2 to 3 months before. In this setting, in the midst of this COVID pandemic, he got some chest pain, some shortness of breath, and then he drove himself down to a hospital in Hyderabad. And then what happened was they said, okay, you can sit here. And then he sat there, but no one would check on him. Another hour passes. All right. And then they said, no, we can't check yet. You have to wait. And then another hour passes. And he says that I can't even breathe. I can't breathe. And then they said, no, you have to get the COVID testing done first. So we had to wait for the test. And then we had to get that. Until then, you can't get in. So this happened from evening 7:30 p.m. until almost 2 a.m. 5 to 6 hours of time wasted. And then around 3 a.m. or so, finally he got into ICU. And then, they said he's not doing well and all that. So his ejection fraction was 20% for doctors who know. His heart was very weak, ejection fraction 20%. And 2 months ago, it was fine. And we don't know exactly what happened, but he died around 4:30 or 5 a.m. in that hospital. And before that, they told my relative, his wife, please go get his toothbrush, paste, and all these things and all that. And by the time she went and got those things, they declared him dead. So I'm mentioning this. I'm not saying these things happen to everyone, but what should people do, patients do, when these kind of practices happen, for whatever reason it is, in hospitals? The delay in care is one of the biggest things. As a patient advocate, I will be extremely frustrated if there is delay in care. Yeah, half an hour, 1 hour, maybe 1.5 hours. When someone is really in this kind of situation, no one checked and seen what has to be done urgently. That emergent response was not there. Now they face death. We as family members, we were shocked. It all happened in a matter of less than 12 hours. Everything. My cousin flew from America and then to India to talk to doctors there, and they keep postponing the discussion. And we still don't know exactly what happened. They shared finally some information. You get tired of asking because you have to deal with death. You have to take care of the dead body and many other things. So I'm taking patient side now, even though I'm a doctor, because at one point of time, we all will be patients at one point of time. So these kind of issues, where is the problem? How to actually fix it? So Dr. Karthik and Dr. Gopichan, Dr. Lakshmi Devi, who are in India, can you help everyone understand, not just me, but patients also, how to handle these kind of situations? What could have happened? And every situation is unique. I do understand it. And because we are talking about death, can we please talk about this?
See, I'll mention two points. Death is inevitable. Fine. Almost everybody accepts that and things like that. But what people expect from doctor is the fighting doctor on behalf of patient. And the doctor, I mean the entire team. From the security man, from the reception to the other members. If all seem fighting on behalf of patient, doing and seeming, appearing, then there is that sanctity that from the patient's attendants and the relatives, friends side, that their emotional bonding for the patient, ailing patient, he is joined by a fighting team for the sick person to recover to the best of possibility. When it is seen as a procedure, even then it is acceptable if there is value for money, value for attention, and their norms and standards come into play. When these two do not happen, when the emotional feel is not reciprocated by a fighting spirit that appears and that hits, that there is a fight on behalf of patient, or when the standard norms of meeting, those are not maintained, like cleanliness, well lit kind of situations are not there. Even a ill-kept bathroom may give an impression of carelessness on the entire doctors and nurses team.
True.
So these 2 points, fighting or standards, probably both. People don't complain in a very low infrastructure place if the doctor and the team are seen fighting, putting effort, whatever is the strain load. If that is not there, standards must be there. If they are not met with, the patient satisfaction is not there, patient attendant satisfaction is not there. Maybe they can effort, but they cannot do the technical know-how and the work that only other members, knowledgeable members must do. Their emotions should be complemented by the fighting and the standards. When the reception person asks the worried traveler patient, do you have insurance? That is for the financial standards within the hospital infrastructure and everything, one understands. But for the patient and the attendant, that is a direct giving message that the entire hospital doctor is seeing my purse, not my problem. And this doctor, this hospital is going to treat me according to my purse, not my need. I may have somebody who may help me, but the first question at the reception in India, perhaps in the US also, do you have insurance? That question by the receptionist creates the wedge, and the rest of it is a afterward flow and everything. That's it's solvable, and that's the point I see.
Sir, very good point. Very good point. The first question is insurance question in India. That is what you mentioned. I want to share something here. In America, we have this triage. So there is someone, a nurse or someone else, who, when the patient comes to the emergency department, even before the emergency department, outside the emergency department, sometimes someone sitting there and they take questions. What is your problem? Da, 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 da. After all that is done, then they send them inside. And then there is a patient care associate, what we call a clerk, who comes and takes information about insurance. So the reversal of how you ask questions and what you ask when the patient comes to the hospital first, I think is a very important point that Dr. Gopishan made. And I just wanted to share the best practice that we have here that helps to some extent. There is another best practice that we do have in America that we need to consider is there is a patient liaison, patient relationships. There is a separate department, and it's very active. When a person is not happy with the doctor or the nurse or some other thing, they have a voice. They can call this number, and then someone is going to answer it, and then they will come up, they will speak with the doctor, they'll speak with the nurse, they'll speak with the team, whoever it is, if it is in the hospital, in the hospital, and they communicate back to the patient. So patient has a voice to express their concern. That reduces the risk for causing violence. When people are heard, when people are understood, it is about understanding. In my opinion, a lot of this is about understanding. When people feel understood in the face of death or whatever other challenge that they are feeling, most of their emotion will be dissipated. Most of the negative emotion will be dissipated. when people are not understood, no one is talking to them, no one is communicating to them, that is when things go bad. I'm talking about it from a patient side. Now I'm going to talk about it from the doctor side. From the doctor side, you have like, even in America, when I have to see per day, like 20 to 25 patients and do all the electronic charting, you don't have time more than 10 minutes to spend with the patient. Sometimes, yes, you do spend more time. You take out extra time and just do it. But it is just not possible for every single patient. How do we manage that expectation? How do we communicate in 5 minutes what you want to say very clearly? There are certain things that doctors can do when you actually sit down with the patient, hold their hand. It feels to the patient that you have spent a lot of time. When you stand up and the distance is more between doctor and patient in that room, or when you're running away and talking, even though you have spent 5 minutes, it only looks like 2 minutes. So there are very basic things that the junior doctors should be trained. No one teaches us these things when we in medical college or later. I still remember when I fresh came out of my residency and then practicing, the way that I dealt with things is much different from how I deal with things today. And some of these things will only come with experience. No amount of training will replace it, only with experience. The tact with which you handle a situation. So all these points are important, but there are two sides of the coin, and doctors are so busy. That the point I'm saying, the doctors are so busy, you're asked to see 200 patients in a day, especially during these COVID times, new disease. You have to wear the mask constantly. There is so much going on. You don't know whether you're going to get COVID. So, but like I am taking patient side, but patients also should take doctor's side. What are the problems that doctors are going through? Why is this happening? Why? What are the problems the corporate hospitals are facing? What are the problems that government hospitals are facing? People need to be made aware of the problems, both sides. Both sides should come together. Like Dr. Gopichan said, the public and doctor relationship. I'm not talking about an individual patient or doctor relationship. The public relationship with the healthcare system is fractured, but it is still repairable, in my opinion. And that needs to be the main focus. Until that happens, until that understanding is there between these two entities, and the media should help, the social media should help, everyone should get on board with their single purpose. A lot of negativity will come down. Understanding is what dissipates a lot of negativity. We may not be able to change the law tomorrow. We may not be able to implement the policies, everything in the next 6 months or even 1 year. But we have a very powerful tool, that is understanding, discussing. What is your problem? As a doctor, as a healthcare system, people should come. Media people like you, Ramya, Seshu, should advocate for this and help give doctors and hospitals a voice. What is their problem? What are the struggles that they are feeling? People may agree, may not agree, but they will understand what's going on behind the scenes. The same thing with patients. Patients should come up and patient bodies. But anyway, so I'll stop here. Karthik, I interrupted you and it went in a different direction. And then Dr. Gopichan had made some comments. I made some comments. Do you have anything to add on to this, Karthik? And then I'll go to the next person after you. I know we have a lot of points to make, but yeah. Karthik, I muted him.
Yeah.
Okay. Okay, please go ahead. You see, he is in the
So
hospital.
we had a system.
Dr. Karthik is in the hospital wearing the mask, trying to do two things. See how much multitasking is needed. Please go ahead, sir. That's doctor's life. People need to understand
Nice
it.
to have
That's
something
doctor's
like a
life. He has done medical college, then MD, then super specialization, and then there's so much goes into it. Yes, sir, please go ahead.
So we had something like an SOS call where people can call or the doctors can call if there is some issue which is happening in the hospital. And IMA, we have a task force which we have laid out, and we just rush to the hospital to make sure that things are set right from this, from our side. At least the doctors will have some self-belief, or they get to have some strength, which at least 10 or 15 of us are standing and with him, and to solve the issue. Predominantly, as you rightly said, we have to calm them out. We have to make some things straight, and to tell all of them, like even the patients and the patient attenders, there is no negligence from the doctor's side. This first time. And second thing is, this is academically right, or whatever is necessary has been done. With what available facilities are there. And third thing is, the financial part of it is where most of the trouble comes up in the private sector. That is what I've been telling, and that is what I've been pointing out. And once that is settled down, I think 95% of the issues in the private sector are done. And coming to hospital issues related to have a call center for the patients. This is what the government has actually implemented during this COVID time, and where people have called for various issues of even admissions, and a lot of them have gone through admissions through the call centers. A lot of them got treated freely, where the government has reimbursed the hospitals, but the amount of reimbursement was very less. That is what the private hospitals went through a bit of kind of strain, and they had no problems. And a lot of deaths happened during COVID. And people who came through the government call centers never had a problem, even though there was death. So we can see there are a lot of technology also being added up, and a lot of associations have taken up issues with strengthening their, I think, unity, and we should be going about it. This is what we have. If I missed something, you can just ask some more, because I was seeing a patient. So yeah.
No, great points.
Yeah.
Great points. I want someone else to add to this. I think Jayanti, madam, wants to add something, and then Dr.
I
Gopijan wants
just
to add
want to
something. Please.
add, Dr. Kiran, and I just want to add one point. What Dr. Karthik said is rightly said. See, whoever is approaching the courts, especially the consumer courts, you know what is the relief they're asking for? Not the life of the dead person. They're asking for compensation. The demand is for compensation. That means they're quantifying the life of a human being. So it's always a life vis-a-vis the cost. So when the cost is going up, when it's going to exorbitant heights, that's where I feel on the scale of 10, 9 cases are happening, these mob attacks or whatever, is because of that.
You made a very strong point, madam. If, for example,
when I analyze all these consumer cases, what I see is compensation. Anything compensation.
Yeah.
So human life vis-a-vis the cost.
It comes down to financials always, no matter, because we live in a money-centric world. That is what the world is. It is I'm not saying it is good or bad. That is what the world is. So I would say this, if I buy an iPhone with $1,200, I expect it to work properly.
Exactly.
If I have any problem with it, I'm going to be very upset. If I buy a phone with, hey, $50, if it goes bad, I'm like, that's fine. I'll buy another one. So the cost of the healthcare that we are providing should justify the value from our doctor's side and the healthcare sector side and government side. I think that is what people need to think. Are we providing, I'm charging 2 lakhs rupees per day, let's say. Am I providing all that is needed for the 2 lakhs rupees? And is there anywhere there that this is the standard? Do we have a standard? This exactly should be. Are there, to me, I'm not sure about it, but what I heard from different patients is that there is no clear standard. But I would like to ask doctors in India to actually answer this question. Dr. Gopichan, sir, please unmute yourself.
See, value for money is a concept. It must be addressed. There is a practical problem that is unaddressed by the existing all hospital managements, all over, government or private. See, if there is, as you say, 2 lakhs or 3 lakhs that is charged, for a phone, the person holds the entire 2 lakh unit in hand. He can check this side, that side, check the box and everything. Same with any other thing. One goes to another different service, saloon service, whatever is the charge. Typically, in a hospital setting in India, whether it is government or private, the patient sees the reception, goes to the floor and the room, goes to the operation theater perhaps, where he is under anesthesia, and comes back to the room and goes out. Attendant walks in the corridor. The 2 lakh charges go for the unseen things, the laundry, central sterilization unit, the operation theater, the lighting, the laminar flow system. So the patient, neither patient nor attendant sees the entire hospital infrastructure. So they do not understand. It's difficult for them to get the value for the 2 lakhs. Now add that to communication mismanagement and general management gaps. They have taken money and they have not addressed me in a human way, neither in a standard way. I cannot see why this bill is happening. Same appendectomy in a non-NABH in a hospital may cost 25,000. Same appendectomy may cost 60,000 or 1 lakh or 2 lakhs in a different system setting. Someone who is used to seeing settings may say 2 lakhs, okay, fine. If the pocket is deep. For a person wanting, he is in a different city, different attendant, but shelling 50,000 suddenly, unpreparedly, if the value for money is not seen, it's difficult. So just like McDonald's or KFC, they offer kitchen tours. If all the hospitals during their leisure time, once, maybe twice in a week, under sanitized conditions, in COVID times, after COVID times, whichever, if they offer hospital tours about the hospital infrastructure over a time to different schools, colleges, programs, members, people will understand what is a modern hospital. The ramp at the outside, which is not used, costs. And all the electricity, water, and everything is, nothing is provided for any hospital in the private sector at any service charge. They are all provided at a full rate commercial charges.
Make this point, please. Make everyone note this point.
Value of money is the point. At the same time, hospitals can't cry foul with everything. They have to improve. Unless they tell, how can people understand? We used to have one medical college exhibition. That's it, done with. Every year there should be medical college exhibition so that people are sensitized by the government infrastructure about so many of the things. It creates a rapport, public, and it creates an image satisfaction for the doctors, nurses, everyone in the medical field. And then private hospitals can offer hospital tours, which will be a marketing tool for themselves, improving communication rapport with the members. So what I'm saying is, just like kitchen tours, do create some situation in the visiting hours so that one person understanding things a little more better is one risk reduced a little better. And at this time, I will ask all the doctors who are watching the program or elsewhere about a neighborhood concept. A chinna shop, if a small kirana shop is having a ruckus, all the other members go do as much as possible, and they say, they stop the fight and say, what is happening? What is? I want to know. I am, I'll do the settlement. Stop the fight. You tell me. All the neighbors will come. If it is a larger thing, also people gather at the door or the front yard and they'll start discussing and they'll try to get into and stop fight on the street or anywhere. Now imagine the medical setting. The neighbors of the hospital, the commercial entities, shops, all those things, how many of them even come to see or stop or even come to see?
Nobody.
They feel in a way angry and bitter that this hospital needs that, because the hospital has never made any bonding with the neighborhood 10-50 shops. Offer them health checkup at a complement once in a year, once in 6 months, whatever. So the hospital is not behaving in a amiable, friendly neighbor.
Question.
Not that it should add cost, but there is no initiative.
Question. Good point. Excellent point. Excellent point. We need to note this. Now, the question is, are we equipped with the resources and the financial strength to do that? Because
yes, very much. For this question specifically, every hospital can adopt 100 shops in and around for a master health checkup at their laxity time, when the work is load less or kind of thing or something like that. Make it as a drive, as a anyhow social moment that acts as a social buffer in times of need. It will be a marketing thing. It will be generating communications, good things. They can plan it and do it in their own pace. What I'm saying is, creating health cities creates a cluster of hospitals in one place, specialty hospitals. But the rest of the hospitals within the social fabric need to have socialness, some form or other, with their neighbors. Just let all doctors in the management particularly ask why no neighbor comes to at least stop attack, or if they come, they just sit there and watch. In any other neighbor shop, something like that, they will go stop the mob issue and say, oh, tell us what is happening, what is wrong. Why the hospitals have become alienated in that way.
Here there is a perception issue. Here there is a perception issue. There are 2 points here we need to make a note. One is the perception in people's minds that all these hospitals are bad people. They're charging us lakhs and lakhs of rupees for everything. And so they deserve it. That is the perception in public. That needs to change. And for that, more discussions like this, what Dr. Gopichan said, has to happen. So other corporate hospitals also should be given opportunity to explain the problem. So it comes back to understanding, bridging that gap between public and healthcare systems. That is a point.
Dr. Gopichan, you made a wonderful point, saying that the people, the patients or patient attendants, or in the general public, they are not aware of the various facilities available in the hospital. So the entire infrastructure, which actually costs, when you give quality treatment, when you give quality atmosphere, it definitely costs. Your point is absolutely right. And to make this point driven into the minds of people, one way of doing it is, you said you can take on a tour, which probably may or may not be feasible for every hospital. But one thing that probably every hospital can do is, they're having television screens in the reception. Most of the time, they play only movies on that. Instead, they can shoot their own hospital facilities and display there, so that people waiting in the reception, they view all the facilities that they have in the hospital. They can try to understand the infrastructure. It can be a very small thing about each of those facilities, like laundry, then airflow facility, HVAC system, all such facilities which actually go into the cost. So that way, probably it will help a two-way communication between the patient and the hospital or the doctor, which actually is missing. The two-way communication is missing.
And you know what? There is something very important that we are doing here, almost without knowing, but very powerful. That is, we are being proactive about what we can do as healthcare facilities, as doctors, to improve things on our side. That always helps. That always helps. And that also gives us then the power to ask, we are doing this. We are looking at all these things that we are supposed to do. You tell the government, you tell the public, you take responsibility for your part. What are you doing about that? And the government's responsibility, in my opinion, here is, apart from providing the support and funding to the hospitals in general, improving the infrastructure, standardization of protocols, and monitoring them. That is one thing. The other thing is passing the law that is needed to protect the doctors, right? Apart from that, a big thing is health education. health education to public about anything in general. Like, if, for example, take COVID, just take COVID, for example. There is so much misinformation in the society about COVID. So much misinformation. One topic I'm talking about, only one topic. Now, how many health issues that we have in our country in a given patient? So many things. There should be a very clear health education plan for all the patients, all the public. Why aren't media not promoting education? Why is always there a debate? He said this, why don't you both fight and let us get more TRP ratings? That is how it is. I mean, media is doing good, but media is also doing some things that aggravate things, right? So my request for media is, why can't we have more educational programs with government help, with doctors' help, with public help, and disseminate it, maybe in an entertaining way? I will let Ramya answer this question. Ramya, please.
This involves business.
You need to get closer to the mic. We can't hear you.
Yeah, am I now audible?
Not still,
No.
It's low. Your voice is low.
I'll try to increase. Yeah. Hope it's better now.
No, your voice is too low.
Too low.
I don't know why. Let me try to be a little more louder then.
Okay.
So this point of discussion showing in the media, there is a limitation. If any government hospital is shown, people would love to see negatives of it. It is a business.
Is it on speaker? Is it on speaker, the phone or whatever that you're using?
It's on a regular phone. It's on a regular phone.
Yeah. Is it on speaker mode or no?
No.
We can barely hear you.
Now, I'll switch off my camera and speak on the voice then.
Yeah, go ahead. Yeah.
Hope it's better now.
Much better.
Showcasing any good thing about a hospital or a medical sector can be for a little time. In media, there is every channel has 1 hour must show about any health issue. So, and if you observe any channel, any news channel, 2 to 3 or 3 to 4 is a doctor's time, doctor's hour. Hello, doctor. These are the programs, sir. So these places are also being converted as the place where any hospital, they do pay to the channel. See, when a corporate hospital is different from a government hospital, a paid show is different from a normal show. As you always know, when a dog bites a human being, it's not a news. When a human bites a dog, it's a news, right?
Yeah.
It is that simple. A normal practice of a doctor may not be a great thing every day for everybody. But one unknown case, like having triplets at one delivery, or 4 children at a single delivery, or some unknown case being solved, or two joint siblings being divided. These are rare cases, are always a hit news. We can't expect every time to showcase all the hospitals, because there is, again, it's a business. When a corporate hospital can shower money and ask them to show for 1 hour.
Ramya, I want to interrupt here one point. I don't think anyone is asking to showcase hospitals in media. What I am proposing is there should be more health education programs in media in an entertaining way, in an engaging way. That is something I think media needs to focus upon. Yes, in an occasional case of Siamese twins, an occasional case of, like you said, human has bitten the dog, will be there. Yes, okay, there is sensation. Spend 20% of your time on sensation, getting those things.
Unfortunately, sensation is first and the reality is next.
I know. That is the reason I'm saying, if media wants things to get better, then media also need to take a role in this one. I'm saying every single person. A problem in a society is not because of one section of population. A problem in a society is multi-layered. There are multiple things that happen. And all those need to be taken into consideration. And everyone must take role in improving things in society. It is not just, it's never one person. The politicians are able to bribe people because the people are taking the bribe. And because the people are taking the bribes, they are not able to ask questions loudly to the politicians. So that, like, I'm just giving an example for that, but the same thing everywhere. Yeah.
Topic as of now. So I'll ask Dr. Gopichand also to involve in this after a minute of my submission. Media is in the last position to media, as we rightly said little time before. It's like a mirror. Whatever comes in front of it, it will showcase it in the right way. It will magnify it. It is a zoom box. Definitely, media has nothing to do with this. It is only a showcase. Frankly speaking, if it is but initially there are great things which we can do from our end first. Media is the last thing to speak. A patient and a doctor relationship is the first thing to speak. I don't say media has nothing to do with the life. It is the easiest one. I said now, like in the good, I mean, a 4-road junction. If you place a 10 by 10 feet mirror on the road, if whatever comes in front of it is magnified in a way. So before going in front of the mirror, it is our responsibility to showcase ourselves in the right way, to put ourselves, present ourselves in the right way. Like Krishna sir said that, and the televisions which are kept in the hospitals, in spite of showcasing a serial or a movie, they can show about themselves. But who is going to watch it? Only the person who is getting into the hospital, and the attendant is only able to know what is going in the hospital. But hospital is something which is to be understood by the healthy people who might come after 10 years with their dearest one into the hospital. Today's industry is not for today, it is for tomorrow.
So Ramya's point is media is a mirror of the society. I think that's a good point. And we'll discuss more about it, but I let Dr. Gopichand respond to this point.
To Manoj and Ramya and members, if I surmise, the hospital tour, say for example, for the children, for the school children, half day in a month, 2 hours in a month for one school, 20 children, 40 children, showing different how a hospital functions in a sanitized way. Systems, let them talk to security, safety, reception staff, a doctor, a nurse, a cleaning boy. They will have a different impression about the entire system. There can be a competition, essay writing competition, picture competition writing. All the parents of the children and other members, they will all have multiplier impact. If done over a 6 months period, the hospital will create an impact about the entire hospital system in the city, in the entire city social fabric. It is possible. We need to have standards, timings and everything. Maybe one doctor every month can be done. So that's possible. Once that kind of spokesperson system proactively develops from the medical side, there is news. If such a thing is happening, media will want to cover who is doing, what is the impression on the children, parents, different things. Media has something to report on, talk on. So if nothing is provided, no communication invites bad communication. No good money invites bad money. No communication except self-pity and then bitterness with everybody. Where is the space for media to come and talk to? So I don't blame media. We need to create those kind of things. I'll share one brief narration of story and a strong alarm for the days ahead. The story is one of the friends, my friends, in a car crash near Anakapalli bypass road, had some difficulties and tear, and the local doctor there stitched the eyelid, and that's it, crash and everything. So the person was brought to Vizag. The next day, the morning time at Vishaka Eye Hospital, a premium eye hospital, and the person is taken into the OT. And from the OT, information has come that some fine glasses is remaining. They are correcting and doing the repair. And the friends of my friend all gathered in an angry way that to go and almost do a mob issue and perhaps attack, do whatever, intimidate, threaten, frighten that doctor, that hospital at the bypass, Anakapalli bypass. And one of the members saw me and came and asked me, the Gopi Laila, this is the way we are all lying. Then I said, tell me what. Then they said things. I mentioned to them that what that doctor has done there at the bypass, the Anakapalli bypass, actually saved the eye from popping out because the lid is torn and bleeding and everything. So there, with the system available, he did what is necessary and what is possible there. Because that is done, this refined hospital is able to do the finer thing to align properly and enable stronger thing. And all the group, angry group, became so grateful that they went and thanked the doctor there. Understanding results in action. If we don't provide information, there is no understanding, and hence there is action out of anger, out of communication gap, out of angst. So there should be something that is provided, number one. Second thing, COVID scenario in India, across the world perhaps, definitely in India, has created further rift between doctors and public. Whatever said about doctors as frontline warriors and everything, people all understand and empathize, sympathize with doctors for facing the risk and everything. But generally, most of the public are not having empathy with the doctors community and the hospital infrastructures and everything. For all the ills elsewhere, doctor is a soft target. So imagine the course of hospital stay and the discharge with all the COVID norms for all this while. The patient in general sitting is having visitors standing by, attendant and everything. Even the long fought, bitter foughts with relatives and friends, they settle down. Someone will come say, okay, we fought, now get well. The tough times bring people together in general in health scenarios. And someone may share something like that. And the discharge, the bill and everything, whatever. Now compare that with the COVID. All the 4 or 5 days, the person is all alone, feeling like being in a jail, not having any visitor anytime, with the norms, feeling. And then that COVID patient is not seeing any doctor, any nurse, seeing only the masked people and the PPE people. It's a painful stay. And at the time of discharge, because the person has perhaps joined out of panic rather than the need of the hospital infrastructure, but requiring medicine. The hospital may have given oxygen and medicines, and the person after 4 days, 5 days, he says, I am only treated with tablets, not knowing what is going on at the human HR issues. Staff are not there, extra staff are brought, cannot be brought from anywhere. Some members are already in quarantine and things. So these things happening in spite of that. So that all of that is not seen, but stay is painful. At the time of discharge, the bill is very frightening. Whatever is the bill, because they see, I have just stayed, I've eaten, I've given samples, not even injections, not much are given. So imagine this load, sudden expenses, whether it is 10,000, 1 lakh, anything. The entire public is having extreme angst and anger. Just yesterday, I was in a meeting at a prestigious campus with a former bank chairman. I was coordinating the meeting. And in the meeting about the higher academics, making India stronger, at the end of it, one of the persons, all faculty, 60, 80 faculty of different branches, one asked, sir, hospitals are looting in COVID time, banking norms and every regulations, what to do? That was the question in that kind of meeting. Imagine. So unless the public anger is addressed and doctor public relation is improved, doctor side stories are told, along with sympathy, empathy is also built. Unless we do that, all specialities, all doctors are at risk of precipitations of mob attacks, intimidations, and so many things in the post-COVID. Post-COVID doctor is even more precarious than the public. Then we can solve it, we can manage it. Yeah, this is an alert. And that story is about communication. Once we have, as Rami Garu said, once we have it, some information, media can definitely show. Let's not blame the media as it is. Let's provide information, stories in an interesting way.
I wanted to add a little point. If something is in a newspaper written wrong, there are people who mob the news editors place. Like something wrong happened, Inadu paper, Ramoji Rao Garu is taken to jail. Some news channel head, they've been put into jail. There are many situations. If any hotel, if they did not provide proper food, the one who cooked it is put under bars. The manager or the owner of that hotel is also put under bar. So these are the things. A mob attack is everywhere. Let us not just put in front of the greatest people on the earth like doctors. It is not only confined to the doctors thing. Now we shall understand this has happened and this is shown. As you rightly asked me, why the media is not showing? If we start showing things like Anandrao Garu, that medicine from Nelluru, so good things are shown for some time, it can be turned in a wrong side also. So it is a very care, as you rightly said, the media is a very sharp weapon. In a minute, it can turn anyway. So you don't know who is playing the game behind it, but you have to be chopped by its hard effort. So don't expect. It is good to not to be on media so far. That is a right way of saving ourselves.
Actually, in extension to this, I would like to make a point here, especially in the corporate sector, the doctors, they are actually employees of that organization. Most of them, they don't be a part of the, I mean, they are not partners of the organization. They are mostly employees of the organization. And they are the patient facing people. They don't, they are not decision makers per se. The management is different from the treating doctor. This is what is actually the missing link or the misunderstanding between the patient and the doctor, or the patient's relatives and the doctor. When there is something wrong that is happening, or when there is when the patient's relatives feel that justice has not been done to them, or they have not got value for their money, as discussed earlier, they immediately beat the doctor or the nurse or somebody else who are not actually the decision makers. And Ramya was telling, when there is some problem in a press or something, the editor, the chief editor, is held responsible. Similarly, something goes wrong with something in in a hotel, the hotelier, the MD of that organization, is held responsible. Likewise, in a corporate sector, when the doctor who is not a decision maker is directly being trashed, instead of that, they are actually supposed to talk to the management and resolve the problem. There's no point beating the employee, the doctor or the nurse or somebody else, a lab technician.
There's a strong point to be made. Yeah, there is a good point made, Krishna Mongar. Most doctors, they're simply employees. The nurses, the staff, yes, they're treating and all those things, but just beating anyone is not a solution. That is where that line should never be crossed. I think that law has to be passed. Yes, sir. Go ahead.
I should ask one question. If any mobile customer care got a call, in initial days we used to call a customer care. I have recharged for 10 rupees. You have taken all my 10 rupees. Why did we used to call? And there are people who abuse them. We never called Ambani and said that why is that you're eating my 10 rupees. So this is something where it is sensitive, but the front end barrier will take the heat. That is their job. Most of the time.
Yeah, but it should never, the heat is okay, but beating is not okay. That must be very clear. Heat is okay. Heat is going to happen anywhere. It doesn't matter which part of the world it is.
Okay, if that is to be taken care, and who is going to stand by the side of the patient? In that
No, beating, okay, like we discussed earlier, Ramya, the beating and violence is only going to compound the problem. That is never going to solve the problem. It doesn't matter what the reason is. It doesn't matter. In the end, it is going to cause more trouble. So it should be a very clear message to everyone. Beating, physical abuse, these things are absolutely not tolerable. They must go to jail. I mean, that should be very clear.
Unfortunately,
who stands by the side of the patient is your question. Here is the answer. Most of the times, it is not the patient's family. It is the antisocial elements which look for such opportunities.
Yes.
They come and do the violence, not the patient.
There are people like that. Yeah, there are people like that who are looking for opportunities.
Yes, they look for opportunities like this. Most of the times, it is not the patient's direct family members who cause violence. They're their friends or some antisocial elements who get into the picture and take that opportunity to create violence.
Yeah. Yes, sir. Gopijan, sir, you have something to say.
For what Krishna Mohan Garu said and Ramya added, there's only one group which gets away with the liability side, with all, on a lighter note, on a deeper note, whichever way it is taken. Politics side, if any mishap, everything happens, bureaucrat is thrown as the black sheep or whatever for the liability side. And politician side, anyhow, I'm punished once in 5 years kind of thing. So that's the only group that has that kind of facility in the system. Okay, and coming to the doctor side, whether they are employees or partners, associates, in the public perception, hospital is doctor. And the condition, treatment, recovery, credit is given to the doctor. If it to whatever extent. So doctors, if they're happily taking credit but not sharing with the anesthetist and the other team members, they should be ready to take the heat also. If the captain of the Indian team takes a big credit, lion's share of win and everything, if there is a loss, a definite humiliating loss, the captain should also be having heart enough to take the heat criticism and respond accordingly. So doctor in India takes a lion's share of credit. Very hardly we see doctor, lead doctor, let me say, lead doctor share credit with the patient about all the things. Some may do, but it's not on a standardized way.
Yeah.
So for the public, doctor, hospital is doctor. Till that perception is there, this technical answering the doctor is only perhaps a staff there, and management should be asked by the public. That won't work out. And last, practically, regarding the mob attacks, damages, physical damage component, I'll share something that a police official shared in one of the meetings that I was there. I invited a member. He said he shared a statistic from other country, US that is, and he shared that you can do it. What he shared is metal detectors are placed at the hospital entrances. So all the patients and attendants and anybody coming into the hospital premise, other than doctor, whatever, they'll not be carrying any metal kind of injuring objects, knives, whatever, revolvers there in the guns, whatever, knives. So the person carrying a knife, carrying a metal harm that can harm, that itself creates that kind of empowerment emotion in the person in that agitated state. One of the members can have, and that creates a group psychology of all the heat and everything. So metal detector at the entrance of all the hospitals, metal detectors, not just the security, will provide a deterrent. Once they're passing through, that creates one safety zone, confidence for the entire hospital staff. It costs less, it gives more confidence, and it's an infrastructure expenditure, depreciation, everything can be claimed in the IT returns. And in the people also, they'll not feel too offended because it's done for the security, insecurity, fear component, as Ramya has said. So not that people carry arms and knives into a hospital, but that is kept there will create a certain deterrence, and members now so much is possible. So metal detector and some workshop on something like anatomy of a mob attack, how a police force from gathering not to become a mob attack, how they deal with the mindset, the application mindset, who to talk to, how to make them sit at the reception. Let people not stand and talk. At any customer care center, they'll offer a stool, chair. So receptions have chairs for the members to talk to them. So those kind of practical measures, 2 chairs and a metal detector, can prevent perhaps or reduce the physical damage. Is a quite worthwhile investment, and it's not too costly for any of the hospitals, even private or otherwise.
It's like reducing some crime because of the CC cameras.
Yeah.
I think these things are important. I want to make a point here. Yes, we do have,
and it will be a news in media.
And
it'll be in news in media. They will study mob attacks, number, issues, doctor side. It will be news. Metal detectors in hospitals will be news.
Yeah. And Ramya will have a lot of information, Ramya, for you, to focus on if you get that kind of stuff. So yes, metal detectors are helpful, but I want to make a point here. The workplace violence is one thing where something happened there and people act aggressive. Usually the attacks on doctors and nurses at workplace, the violence, even though may happen, and does happen, it is less violent. What I mean to say is people are stalking doctors, nurses at their homes and some other places and going and trying to kill them or injure them, because at work you have some kind of support. Other doctors, nurses, other people can come and prevent that kind of stuff from happening. When you are outside the hospital and we are going somewhere else, that is a totally different issue. But I do like the metal detector idea and screening at the hospital, which we do. here. So we can solve all these problems in one session. So what I would like to do is, because we are almost close to 2.5 hours now, and more than 2.5 hours, close to 3 hours. What we should do, I believe, is this is a very good discussion that we had so far. And problems like this cannot be solved in one call. We know that. But this is a very good step towards that, understanding the problem. Without understanding, we can solve it. So I would like to invite initially Mr. Niranjan Rao Garu and then Madam Jayanti. From a legal perspective, you have patiently heard the arguments from all sides so far, like a judge, huh? You both of you. So what are the things legally that you suggest that we should take home message in this conference? And after that, I would like to invite Lakshmi Devi, Dr. Gopichan, Dr. Lakshmi Devi, to share their viewpoint as what we as doctors should do, okay? And then I would like to invite Manoj and Ramya to share their perspective, what media has to do, and also from a people's perspective, what has to be done. And then we will wind down this session. And then I think we'll have a good take-home message on which we can work on and plan for the things. So, Niranjan Rao, you want to start?
Yes, sir. So, thanks for a wonderful session, sir. A very brainstorming session. We also are able to understand many other things which we have not came across in our daily life. Now, sir, the Advocate Protection Act was passed. As a bill was introduced and it about to take a shape of an act. Where in the advocates, where we are standing in the same footage of facing the violence, filing a false cases against us, all these things also being faced by all the advocates. Now, to protect us, the government of India has introduced Advocates Protection Act. It was already been introduced, and there was a committee was constituted by 7 members, Bar Association presidents, and everybody was the members. Now they have given a report how to protect the advocates in case of violence, in case of false casing, how in case of a false arrest, how the advocates has to be protected. So that bill has been already been introduced, and it will in the next session we are expecting that will be an act. So similar way, the doctors or the healthcare professionals should also be given a protection exclusively for you. How the advocates are being given protection, similar way, a specific act in more elaborate manner than the advocates should be given in favor of all the healthcare professionals, and then that will protect you and save us from a lot of unnecessary incidents, and in case of any damage happen, a strict action to be taken against the culprits, and they should be given punishment at the earliest, not taking an elaborate trials and other things can be avoided, provided the government has come out with a specific law.
If you raise your hand against a policeman, you go to jail immediately, isn't it?
Yes.
The law should be like that. It doesn't matter.
Correct.
Which I will say the same thing for every single citizen in the country. You know, if you raise your hand, that's a crime. You know, there is an intention to do crime, right? So anyway, go ahead. Yes, please.
So similar protection, unless is given to all the healthcare professionals, these kind of laws which are now existing are teethless. They are not able to protect the individuals so far, even though 2-3 acts were passed and some ordinance was already in place. But it is not taking sufficient care for the healthcare professionals. So my opinion is a specific act with all the protections should be given. And that should be also being implemented by the state governments more effectively. The police should also be given more responsibility to implement that law. Otherwise, simply registering an FIR, throwing it in the dustbin, and then there no taking action on that, and influenced by the other political circles, all these things should be avoided. They should also be dealt with an iron hand. And when there is of any kind of a violence against a healthcare professional, they should be dealt with very seriously, and then they should be given punishment as early as possible. Then only the others will stop doing this kind of nonsense. If there is no punishment, everybody will taking very easily. There is nothing happen in this country for if you do any damage to the hospital.
One question here.
Yes, sir.
One point here. You made a very strong point, and that is good. Now, one question.
Yes, sir.
What happens to patients? Because patients sometimes, I'm not saying always, are resorting to these kind of things because they have nowhere to go. No one listens to them, especially poor people.
Yeah.
So if there is a strong law, anything that you do, healthcare providers, you will be arrested. All of a sudden, we are shutting the mouths of public completely, and they may not be able to do anything. So what kind of solution for public to deal with this kind of situation in our legal system where it takes years and years to solve a problem?
Correct. There is a civil liability is available to them. They can sue you if there is any damage to them. They can ask you for a compensation if some really damage or a negligence has happened because of the doctor's irresponsible behavior. That protection is always available under a civil law, not abusing or committing a violent act is not permissible. If really there is a lapse, let them be sued. As you rightly pointed out, negligence cannot be accepted in a medical profession. It may be an error of judgment.
Yes.
Sometimes there may be error in deciding this is to be done, that is to be done. There may be an error, but negligence cannot be accepted.
Yeah.
So for negligence, there is a civil liability is possible. Where they can file a civil suit for claiming compensation, as Jayanti Madam has rightly pointed out. That's what is happening now also. So that kind of remedy is already available. Yes, Doctor.
If I may put it Niranjan sir's points in 2 words, if there is attack damage, let it be in a non-bailable section.
Correct.
Second, let there be a fast track process.
Correct.
Yes, sir. Like it. The fast track process is something that is very much needed, I believe. But yeah, only you, Niranjan Rao Garu and Jayanti Madam, you know what are the legal issues, how fast track this can go. Yeah, go ahead, please. Yep.
So that way, the specific law as we have now should be given to you. You are also standing on equal footing along with an advocate. So you are also serving the mankind to a major extent than an advocate. We are only trying to solve the rights of the parties, but you are fighting for a life of a party.
Right.
So therefore, your sacrifices or your efforts are more for the humankind or mankind compared to advocates. So that kind of a protection should also be given to you. And a specific law, if is passed, it will protect from the future inconveniences. That is my view, sir.
Yeah, that's amazing. All the points are very good points. We note them down nicely, and they're well noted. And Madam Jayanti Garu, please, your point of view.
Yeah. So Niranjan Garu has made a very good points, but I beg to differ, because no amount of legal stringent can it really handle a mob? See, today a lot of violence is happening. Do you think that these laws are able to handle them? See, advocates, the profession of advocates and their way of handling things is Advocates Act, Protection Act stands on totally different parallels, because there the human life is not involved in. However, in medical profession, as medical profession deals with human life, right? The element of human life is involved in medical profession. So I don't think, I mean, the involvement of law and courts is only for 1%. Me coming from a legal fraternity, still I'm doing this statement, because the support of law is only just 1%.
Yeah.
End of the day, see, law always comes at the end. It is emotionless. For me, I don't see what emotions are involved in. For me, I only see evidence. What are the facts? What is the evidence? What is the law?
Right.
Beyond it, I don't get into any emotions. Whether the
Right.
fellow demands a compensation of 100 crores or 1 crore, it remains the
Yeah.
same for me, going by the facts, going by the evidence, going by the law.
Right.
Right. So for me, law only comes at the end. The way police comes at the end in a typical Hindi film or Telugu film, law
Yeah.
only comes at the end. How many laws we have? As such, we have this Medical Protection Act 2019, I believe. This has been passed by 19 states to prevent violence and damage to property. But
It's not
still,
enacted.
it's enacted, but it's not implemented. We are unable
Not
to
enforced.
implement.
Not enforced. Yeah.
19 states, including West Bengal, has passed this act, but implementation is very, very difficult.
Yeah.
Because as I said, wherever there's human element is involved, human life is involved in, the role of law is only comes at the end.
Here,
right? So we are coming back again to the problem as well as the solution. See, that communication, that empathy, sympathy, the corporatization, the money and cost involvement, when all these are adding to the actual aspect of mob violence or violence against the doctors, how would the law, instead of addressing them, these issues of corporatization or other aspects, are we only looking at addressing or handling the outcome of this, that is violence?
I actually like the point you made, madam. Are we just looking at the outcome and trying to control the outcome just by putting in law that you can do it, which is going to lead to accumulation of all the problems and never get solved? So I see your point very much. I see both your points. Niranjan Rao made a good point that the enforcement, the making of the law and enforcement of the law is important and it should be severe, which is no doubt about it. There's no doubt about it. At the same time, that alone doesn't solve the problem. You agree with him on that, but that alone is not going to solve the problem. What else is needed is a question. And to answer that question, I think we need to take a lot of points that Dr. Gopichan, Dr. Lakshmi Devi, Dr. Karthik, and all the people, Manoj, everyone else, Ramya, from a patient's perspective, what needs to be done from a healthcare perspective, what needs to be done to solve this problem? Like I'm going to say this, I'm going to outline some points that we learned today. You need to bridge the gap between the public and healthcare communication gap. That needs to be bridged. Proper understanding should be there between what the doctors are going through, what the hospitals are doing, and all that. That perception is very important. And public need to be educated about the expectations when they go somewhere, about self-care, what can you do? And understanding about diabetes, hypertension, CHF, COVID, heart problems, all these different things. Oh, okay. Because in ancient Chinese medicine, this is how they used to pay. If a person gets ill, then they would cut down the salary of the doctor. If the person would stay healthy, they would reward the doctor, because we are so much focused on illness-based medicine, like Manoj said earlier. Illness-based medicine is what we specialize in. Entire world, I'm not talking about just India. There should be more preventive aspect. There should be more education aspect. Then what happens is, when these things like health problems come in, they become manageable. Otherwise, the system will be overburdened, and that needs to be looked into. So definitely your points. Yeah.
Yeah, I have one more point to add. See, it should be a threefold mechanism in place. There should be a preventive mechanism to start with. And second thing is a prohibitive mechanism. Third is a redressal mechanism. So the law and the courts only come at the end. That is a redressal mechanism. So
Can you please elaborate on this preventive, prohibitive, and what is the other one? Yeah.
Redressal.
Yeah.
See, redressal is upon happening of an event. Okay. See, let me start with preventive. So while we talk about preventive mechanism or preventive methods, like to build a better rapport, a good rapport between the doctor and the patient, that is a preventive. That's where the preventive starts. That means whatever at the initial stages itself, you are trying to prevent.
Yeah.
Hardships or that gap or the difference of opinions or the hardships, right? So next
Right.
comes a prohibitive mechanism, like what are the strict do's and the don'ts. At the hospital, what are the do's and the don'ts? What are the SOPs? How the patient and his or her relatives and the family members have to behave on the floor, at the hospital floor. So this is a prohibitive mechanism. What are not strictly acceptable at the hospital premises? Some kind of SOP. Right. The final comes a redressal. Like despite taking all the preventive and prohibitive measures, even some untoward incident happens, then the law and the court comes into picture.
Yeah.
So that redressal is equally applicable for both the doctors as well as the patients. It's not that every time the doctors are right, doctors made the judgment error-free. Right? There are cases of gross negligence and culpable negligence also, where the courts have come very heavily on the hospital as well as the doctors.
Right.
Right. So the redressal mechanism should be equally applicable for both hospitals and the doctors.
Yep. Yeah. I love what you said, madam. You nicely classified into 3 phases, which is very important. This gives a very good framework: preventive, prohibitive, and redressal. And that's a good framework.
And then the preventive mechanism is for both patient as well as the doctors. It's not that only doctors should always be, the tuned or tutored or, given, bunch of guidelines. No, it's for both.
Public education is important. That is where public education comes.
Yes, public education. So this mechanism is for all the 3. This 3 process, whatever I'm talking, is for the both. And in all this entire process, hospitals plays a very, very important role, not just doctors. Even hospitals play a very, very important role.
Yeah.
Because when the concept of family physician is actually getting a natural death, right? And the hospital, doctor, patient, this is a 3-element structure is evolving. That's what we are seeing seeing in the present times. So hospital plays a very, very important role.
Yep.
It is a hospital which has ensured all the 3 mechanisms are adequately taken care of.
Yeah, and that's very good point, madam. I think hospital involvement in this, in the 3-pronged approach, that's amazing. Because you mentioned Niranjan Rao sir's name, I want to see if he has anything to add to whatever that you said. So, do you have anything to add to whatever she said?
I think madam is very nicely projected what exactly is required to be done. That is, I'm fully agreement with that.
That's awesome. So, I want to give opportunity to actually Manoj Garu and Ramya to say their part. And then we'll invite Dr. Gopichand, Dr. Lakshmi Devi, and then Krishna Mohan. I will also ask Nageswara and Srinija to say a few words. Before, I may forget, I don't want to forget this. Nageswara is pivotal in having this conference. It is his idea, and he worked so much behind the scenes to make this happen. And he's a wonderful person and a great friend of mine, constantly looking to do good for people, whether he's working at the hospital, whether he's working outside the hospital, or many other things. So I'm delighted to introduce him, my friend, to all of you, Nageswara.
Very true, sir.
Yeah, nice.
Thank you. Thank you very much. It's my pleasure to be part of this.
Yeah, at some point of time, introduce yourself, what you do. And Srinija is another person who is behind the scenes doing a lot of work to facilitate all this discussion and taking care of the digital aspect of it, social media aspect of it, and communicating with people. So I really want to appreciate her for what she's doing. And Srinija, you want to say hello quickly?
Thank you so much. Yeah, thank you so much, sir. This I am grateful to get this opportunity to do this part, because I've heard a lot about media, And I've heard the positive side if media could help us to reach the people. So in some form, I felt like I'm doing that part in you, along with you people. That's what I felt at that moment when I had so much bad things about media. But yeah, I totally agree that media is the platform where people can see or listen or feel the things what is happening, and it has influenced a lot. And if media takes the correct approach and correct methods to get the right knowledge and right information to people, yes, these things can be reduced in a very faster manner. And I totally agree. And I'm always with you all.
Thank you,
Here I
Srinath.
want to, Kiran,
I
here
also want to
add
thank, before I
one
forget.
point.
Oh yeah, Nageswara, please.
When, in my point of view, when we try to achieve patient delight, okay, all these problems will be solved. To achieve that, we need to have a care beyond expectations process. Okay, when we provide care beyond expectations of the patient and their families, we need to achieve patient delight very easily. For this, we need to have a good communication system in entire care process. Okay. Without communication, we can't achieve this.
Right.
We need to talk. We need to talk
totally
in every aspect of the care. We are neglecting some of the areas where there is no communication. Without communication, there is no care happen, even though there is really care happen.
Wrong point.
As per law also, where there is no documentation, no care, right?
Yeah.
A very strong point. You kind of summarized everything in one line. Without communication, actually, there is no care happen. That is how it looks like. You did not do anything because you never told me what you did. True.
And he was the pivotal for that one.
Huh?
He was the pivotal person for that one in the whole ICE.
Yes, he is. So, yes, nice, Roy. Yes. Any other point that you want to make?
That's right. Patient delight. When we achieve patient delight, that's it.
Patient delight and communicating the patient delight.
Patient delight comes through only communication. Without communication, even though it's happened to be death, if we well informed about the patient death to the patient and their families regarding the process, they will easily understand and are able to digest. Okay. If there are many roadblocks in the process, it's very difficult for them to digest the things. That's why all these issues are coming. Okay. Further, we are having some resource gaps. Okay. Organization should have some more resources to enhance the communication. That's it. It's my opinion.
Thank you, Nageswara. Very powerful points made in just 2 minutes. That's very good. That shows the kind of experience and insight that you have into our healthcare systems issues, because you have been in this for such a long time.
Thank you so much for giving
I hope to have you actually be the part of the panel. I know you are doing a supporting role for now, but I actually want to be the part of the panel next time to share more of your views, actually.
Sure.
Because you can learn so much from it.
So you are empaneled.
Huh?
So he is empaneled now.
Yeah, you're empaneled. You're empaneled.
Yeah.
Yeah. So Manoj and Ramya. So Manoj, you want to say something? I know you have stayed quiet. We did not give you a chance to say anything for a long time.
Yeah. I want to add a few points as a summary. And I want to give very quick points so that the hospitals and the providers, may implement in their respective organizations. Point one, placing the professionals at the points where the public will meet with respect to the affairs of the hospital. Point two, hospitals should periodically conduct a physical risk assessment of the frontline facilities. Frontline facilities, that hospital should conduct periodically, regarding the risk assessment, they should proactively work on it. Point three, Hospitals and providers should record the concerns or complaints of patient attendants and should categorize them to redress in a proactive and preventive approach so that the future incidences may not happen. Point 4, hospital should mandate the patients to submit the details of close group of 3 or 5 patient attendants to raise concern on behalf of patients. And that close group or the particular persons of that close group can be given an ID cards or some tokens so that they can raise their voice with respect to the patient. And the remaining should not be considered for negotiating with the hospital in any form. It may think, the hospital may think more on this, perspective. Point 5, the hospital should timely communicate digitally with the patients regarding patient health condition or the risk factor of the patient condition through a message, to their patient attendants. Point 6, hospitals, can work on incident alert system that may be connected with the local police station or the other relevant local bodies like that. Yeah, thank you. And the next point, the hospital may display the details with respect to the infrastructure available in the hospital and the major components of operational expenditure in the hospital leading to increased health expenditure. So that, the public that, that looks at this display, will mentally prepare, how much money they're really, putting into the system for better care like that. And the last point, the hospital should continuously, conduct the training programs to the health, to the hospital.
We can't hear your voice, Manoj.
Yes.
We can't hear your voice.
Oh, sorry. I hope my voice is audible now.
Yeah, now it's good.
Yeah. My so point 7 is the hospital may display the details of infrastructure available in the hospital and the major components of their operational expenditure in the month or in a year. In front of the hospital, why the healthcare costs are more like that, so that the public who are going through that display will mentally prepare, the actual money the providers have been putting into the system to make or to provide better care to the patients.
Yes.
And my last point is the hospital should continuously conduct training program to the employees relevant to the SOPs that we all have gathered here and we have discussed so far now.
Yes.
And these are all my summary points. Yeah, I'm so fortunate to join with you all. Thank you.
That is excellent summary. Excellent summary. And I think it would be great if you can, I'm sure Srinija is making points, taking notes there, but I think it will be great if you can share the document that you have written with us, and we'll take those recommendations and we'll put together. What I want to do is at the end of this call, whenever you all get a chance, sometime in the next few days, if you can write down 5 of your recommendations. This is what we should do. This is what happened in our meeting. And from this meeting, this is what we think is the best. 5 recommendations from you. If you could share with me sometime in the next few days.
Sure.
That would be helpful. Yeah. Okay. That's great. Thank you. And Ramya.
Sir, I'll put sweet and simple. I'll just recap what we all been through in my discussion. First thing, doctor and the patient are together. It's a game. These two are not two different entities. As long as we have transparency between the doctor and the patient, things are always good. When we all know the Chinese whisper game, when more the people involved in the communication chain and the matter is diluted and diverted.
True.
So when these are delicate and dangerous things involved in a communication, let us make sure the communication part is the perfect essence reached from the doctor directly to the patient and his attendant, not to the patient also most of the time, his attendant. So we have to be so careful. The communication between the doctor and the patient family is the first and foremost thing, with transparency. The word transparency I relate in such a way. There are a few hospitals where they write normal delivery for discharge, cesarean for discharge, AC room discharge, and this discharge, but never the chart matches to the board which they really look at. So whatever they put as on the board should also be on the paper by the time they pay it. If anything, as you said, like laundry charges, which we really don't show to the universe, but there are things we have to do, because that is the reason you're paying more. Let them choose what they wanted. If I have only 25,000 to spend, let them go to that room. So but you're taken to a room where they're supposed to spend 1 lakh and they're expecting it to be 25,000, and that is the miscommunication, because money is involved, danger is involved. As long as it is free, nobody's going to question you. When money is involved, everyone is involved. So that is the one thing. So transparency, and at the same time responsibility also. It is both the side. I always see that there's somebody to stand next to the doctor side, but it is a very rare scene. Somebody standing towards the patient side also in the hospital scenario. So Krishna sir can really give a nice insight about this particular way of solution, because always you find like an alien in a hospital. When a patient comes in and a relative comes in, he finds himself like an alien. He's not a part of a hospital system. He don't feel that it is also a place where I'm healing well. So he should also be given feeling that it is a right place where I am also treated in a right way. No injustice, because money is involved, everything is involved. As Nageshwara garu, we both usually train in the classes. Antaku minchi, you have to give beyond what is expected. So it is very easily India. If we have been seeing everywhere a favorite politician statue, if you wanted to move it and put a new one, like YSR garu statue teeseste, NTR garu statue ragane, there's a big fight here for only a statue. But why not for life? A statue is a sentiment, but why not a life? So everything is important. If it is a free thing, nobody will question this much. So we have to be careful. Then communication part is the first thing. Transparency is the most important thing, and the respect for the pain. If these are not balanced, then comes the media. Last part is the media. Let's hope media doesn't enter into this scene. As long things go
You're very partial towards your media group, Ramya, huh? I'm just kidding.
Everywhere, the mistake and the if I take a mic and put in front of a doctor, when the wrong scene goes on, people say that media is favorable to the patient. If I take a mic and stand in front of the patient, and the media is giving a business deal to the hospital. Everywhere a scapegoat is a media.
Yeah, everywhere scapegoat is media, right? Understood.
So for all the good benefits, let us all clear the problem in the, like Madam said, the three different stages. Initially, problem is at our footstep. Solution is also at our footstep. Talk to the people, things will get done. Nowadays, even a child of 4 years is not allowing his mother to scold. Now, who will allow this in a hospital? Nobody wants to scold or fight with a doctor. There are even doctors in India. Now we pray them from our bottom of heart. We feel that they are really gods for us. ఒక డాక్టర్ గారు కోవిడ్ వచ్చిందంటే వాళ్ళ ఫ్యామిలీ మొత్తానికి ఎంతో మంది పేషెంట్స్ ఫుడ్ సప్లైస్ అడగకుండానే పంపిస్తారు. వాళ్ళ ఇల్లు నిండిపోయింది. ఒక డాక్టర్ గారి వైఫ్ ప్రెగ్నెంట్ అని తెలిసాక వాళ్ళకి తెలిసిన మామిడి పళ్ళ వ్యాపారస్తులంతా బుట్టలతో నింపేస్తారు. ఆయన ఏం ఛార్జ్ చేయలేదు వాటికి. బట్ దిస్ రెస్పెక్ట్ వి స్టిల్ గివ్. వి స్టిల్ లవ్ ద డాక్టర్స్ హూ కేర్ ఫర్ us. Care is always appreciated.
This kind of affection between patients and doctors, and showing that affection, not just thinking in your mind, played a big role in earlier years, decades ago. That got totally vanished almost, except for some examples like this. For most part, it has vanished. That kind of relationship building is needed, very much needed. And how is the question?
అవుతుంది సార్. అది ఒక డాక్టర్ కి అంత టైం ఇవ్వగలిగితే, పేషెంట్ మనసును అర్థం చేసుకున్నంత టైం ఉంటే అన్ని మ్యాచ్ అయిపోతాయి.
పాతకాలంలో డాక్టర్లు, సారీ ఫర్ స్పీకింగ్ ఇన్ తెలుగు, they used to call everybody ఒరే. Whoever big MLA, MP, whoever the big shot of the town, they used to call it ఒరే. ఒరే ప్లీజ్, అరే కూర్చో, తీసుకో, అంతే. That is the affection or the intimacy they and the people also not taken it in a different way. The Spanish talking to you. that kind of a bonding was there earlier.
సార్
And
అది
some-
వాళ్ళు మిమ్మల్ని ఫ్యామిలీ మెంబర్ లా ట్రీట్ చేస్తారు. దే డోంట్ ట్రీట్ యూ లైక్ ఎ డాక్టర్. ఇంట్లో ఒక పెద్ద వ్యక్తి లాగానే ప్రతి సొల్యూషన్ కి ప్రాబ్లం కి రెండింటికి మీ దగ్గరికి వస్తారు. అండ్ యాజ్ అ సైకాలజిస్ట్ ఈవెన్ వీ డూ ద సేమ్ థింగ్. మేము ఒక మిగతా వాళ్ళతో పోలిస్తే వీ స్పెండ్ లాట్ ఆఫ్ టైమ్ విత్ అవర్ పేషెంట్ సో దట్ విల్ రీచ్ టు ద కోర్ హార్ట్. మీరు పూర్తిగా ప్రాక్టీస్ డాక్టర్స్ కాబట్టి మీరు ఇంత టైం ఇవ్వలేకపోవచ్చు కానీ బట్ యూ కెన్ డెవలప్ ఎ సిస్టమ్ వేర్ యూ కెన్ నో ద రైట్ థింగ్స్ ఇన్ ద రైట్ వే.
That is where Dr. Gopichand's recommendation before about that community connection for hospitals. Previously, it used to be individual doctor, small clinic, and then he used to take care of that vicinity people, right? Sandula doctor అని చెప్పి అనేవాళ్ళం అనమాట మా అమ్మమ్మ గారి ఇంటి దగ్గర. సో ఇప్పటికీ ఆ సందులో డాక్టర్ ఉన్నాడు. But anyway, we all knew about him. So that kind of connection is what needs to be built. And Ramya, you made a lot of good points. What I request you also is if you can put it really, because not everything can be captured by the person who is writing notes. Some points will be captured. If you can really put in 1 or 2 paragraphs or maybe 10 points and give it to us, share with us, I will share with everyone else, because everyone is an intellectual here and they're spending their time, energy, their mental strength to come up with this recommendation. This discussion in the end should not go vain. We should, make sure that this is taken forward.
And I'm equally waiting. Krishna sir would definitely have great things to speak. Asla ఆయన ఏమేం చెప్తారా నేను ఇందాక నుంచి వెయిట్ చేస్తున్నా.
I know. I took away his mic and he's supposed to moderate it. But almost unknowingly, I took away that mic. Krishnamohan, sir, I think I very, very apologize for this. To keeping you as a silent spectator and never given chance for you to actually speak. Not intentional.
Unfortunate good things. Ante.
Yeah. So I will ask Dr. Lakshmi Devi now to comment on some things, and then the last few words will go to Dr. Gopichand and Mr. Krishnamohan.
So Kiran, one thing was it was good that all other aspects other than the doctor regarding the media and the hospital thing was all discussed very well. Coming back to our doctor stand, I think that we should take care from where we stand itself. So we have to do it with a controlled and careful emotional touch as well. And the doctor-patient relationship definitely, as Ramya said, is the one which will always be cherished. Okay, so let's avoid negligence in our practice. Okay, and from the legal point of view, let us always keep documentation on the forefront, and also do video counseling. And the metal detector, which Dr. Gopichand said, was also really good, because that helps in screening the people who are coming in, where personal protection is also important. And as our other panelists have told about the legal aspect, that is the fast track law solution, like in rape cases and all, even these cases have to be escalated fast so that we get a redressal system both from the doctor and the patient side as well. So, and as Madam Jayanti Madam has said, emotional aspect cannot be taken into consideration too much from the side of the court. So whatever said and done should be documented, and avoid the negligence concept. Avoid the negligence component out of everything. So I think in that way we can actually go about in a very careful and maintaining both sides.
Well, all the points very well made. It is a very nice summary of what we actually discussed. I appreciate that, Lakshmi Devi. And I want to highlight something that you said, which is the emotional aspect. What I say is, if the emotion, the negative emotion is dissipated, like we discussed before, that is going to solve 75% of the problem, in my opinion. At that moment, I'm talking about at that moment, when someone is angry, upset. And this is a skill doctors, nurses, the personnel at the hospital or the healthcare facility, they need to master this skill. If they can do that, it's going to drastically reduce the chances for violence. And there is separate training that needs to happen. There is a separate training that needs to happen, and practice that whatever that was taught, implement it, and keep getting better at it. Like Lakshmi Devi made in the chat box comment that yes, it is a life skill. It is a life skill, and it is a lifelong skill that is needed, not just for handling situations at the hospital, but also handling situations in life in general. So it is a life skill. And that is my specialization, what I teach people, how to calmly approach any situation, no matter what it is, how to be calm in the midst of chaos. So we'll when the opportunity is there, I will talk more about it. With that, I'm going to give it to either Dr. Krishnamohan, Mr. Krishnamohan, or Dr. Gopichan, either one, whoever can first. Yeah, okay. Dr. Gopichan, go ahead. I think Krishnamohan garu.
Let Krishnamohan speak. Someone is waiting. I am also waiting to listen to him.
Yeah, Krishnamohan garu.
Ramya. Yeah.
Krishnamohan garu.
So,
Sir, ee loga meer maatladandi Gopichan garu. We'll get him in between. Maybe he has taken a little break.
fine.
Yeah.
I'll play a 54-second clip that shows the power of media and social media in this session. Along the session, Dr. Kiran has shared a personal narration about an incident about communication. Am I audible?
Yes, sir.
So, someone is watching the session in US in a place and shared an audio clip to me as Kiran was making that observation and about the patient being in the hospital, morning, all those things happening. This clip I'm sharing to show the impact of the social media across the globe that's happening and the speed of the changes. Let me just play out the clip first. It's by my sister.
Kiran, Dr. Kiran ఇప్పుడు మెన్షన్ చేసిన ప్రాబ్లమ్ వాళ్ళ రిలేటివ్ ఎవరో హార్ట్ అటాక్ తోటి పోయారు, ఎవరు చూడలేదు అనేది. వన్ ఆస్పెక్ట్ ఐ కెన్ థింక్ ఆఫ్ ఈస్ హాస్పిటల్ స్టాఫ్ కి సరిగ్గా ఎడ్యుకేషన్ ఇవ్వలేదు. వాళ్ళకి ఓన్లీ స్టాండర్డ్ ఇన్స్ట్రక్షన్స్ ఇచ్చారు. దే ఆర్ ఫాలోయింగ్ దట్. ఇట్స్ లైక్ ద పర్సన్ ఇంటర్వ్యూకి వెళ్తూ వాళ్ళ అమ్మని అడిగాడు ప్యాంట్ సైజ్ చేయమని, వాళ్ళ సిస్టర్ని అడిగాడు, వాళ్ళ వదిలిని అడిగాడు. సో ఫైనల్లీ ఎవ్రీబడి డిడ్ దట్ సైజింగ్, బట్ నోబడి చెక్ వెదర్ ఇట్ ఈస్ రియల్లీ కరెక్ట్ ఆర్ నాట్. సో అలాంటి దాంట్లో సో వాళ్ళకి స్టాండర్డ్ ఇన్స్ట్రక్షన్స్ లో సినారియో ఏంటి అనేది ప్రాబబ్లీ వాళ్ళకి ఎడ్యుకేషన్ లేకపోవడం వల్ల హాస్పిటల్ స్టాఫ్ కి దట్ మైట్ బి. దట్స్ మై థాట్.
Yes,
So,
thanks for responding to this.
Kiran garu,
yes.
Some of my clients are still waiting for me. I may be permitted to leave.
Yes, sir. Yes, sir. Please, thank you. Thank you very much for joining this.
Sir, it's a
And
pleasure.
I just want to mention one more person here who is not here, but behind the scenes did a lot of work. I want everyone to know that is Mr. Seshu. He is a journalist, and he has been helping us putting this program together, and again having it live on YouTube and doing many other things that are needed for promotion of this one. I also want you to know that, and thank you, sir. Thanks for joining this.
Thank you, Dr.
Niranjan garu, two quick points, half minute. If half minute you can just say two points.
Yes, sir.
So I'll mention only two quick points. Prevention and redressal using the MAM's language. Mob attacks are tip of the iceberg. The tip of the iceberg is doctor-patient relation. The entire iceberg is doctor-public relation. So long as we concentrate only on the tip of the iceberg, we'll be looking at it with a band-aid kind of approach. If we look at the iceberg, we will solve many things. We'll prevent the accident proneness in any given scenario, number one. But having said that, for whatever reason, if a mob attack happens, damage happens, because it has collateral damage, it has far-reaching points, we need the non-bailable and fast-tracking process, and all doctors trained in general management, communication management, and speaking to lawyers also. Legal communication management, that will help if it happens. But the issue focus should be on the iceberg itself, which is the societal issue which is precipitating into the mob attacks. That's the doctor-public relation.
One point here to add to that is these both things should go on simultaneously.
Yeah.
Simultaneously.
Thank you, sir, for staying. Yeah.
Yep.
Thank you, sir, for staying on and
you,
listening to the remarks.
Thank you, Madam Jayanti Garu. Ramya Garu, thank you very much. Thank you very much.
Thank you.
See you soon again.
See you soon again. Yes, thank you.
Thank you for all your insights and bridging the right generation gap for all of us.
Your experience for many decades helps us, and we would like to learn more about, your recommendations and what can be done in this situation. Thank you.
Thank you, sir. We will catch up again.
Sure. Thank you, sir. Thank you.
Okay. Bye-bye. Thank you, all of you.
Thank you. So, any other comments? So, who else? I think Krishna Mohan Garu and Gopi Chand Garu, if you have any final comments.
I spoke at length. Perhaps I should just cheer the administrators and the digital team and the members for putting up the show, and special appreciation to you, Kiran, and all the panel members.
Thank you, sir. So we'll now end this meeting in a minute. Let me just share last couple of words here. Lakshmi Devi, thanks so much for learning, getting into college again and learning about law. I think we need more people like you.
Congratulations to Lakshmi for topping the class. We demand a party. We demand a party.
Yeah, and the same for you also, Gopi Chand sir. You got a gold medal in pharmacology way back then. You never gave any party, so we expect that too.
Yes, sir.
He's a microbiology medalist, Lakshmi Devi.
Okay. Wonderful, wonderful.
Yeah, ఎవరిని మర్చిపోయేది లేదు, ఎవరిని వదిలిపెట్టేది లేదు, అందరూ రావాల్సిందే.
We will have bold parties. We'll have bold parties. Okay.
Yeah.
We can end the live thing, sir, but we'll still be on to talk something beyond the lines also.
Yeah. So I want to thank everyone, Manoj Garu, for sharing such nice points. Okay, 10 points plan, Pranalika. That is excellent. And Jayanti madam, thanks for especially of all the things you said. There are a lot of good things you said, but I like the grid. 3 things: preventive, prohibitive, and there is a third word also, redressal. So these 3, I think whatever that we discussed today, if we can put a grid and write down what falls under prevention, what falls under prohibition, what falls under redressing things, and then put together, I think that will be great. I love that. And Ramya made a lot of good points from a media standpoint as well as from people's standpoint. One of the most important points that she made is the media is a mirror of society, which I totally agree with. And that puts a lot of responsibility on the society and how to change the society. And the ball will be given to media also to do that along with everyone else. And Nageshwara made a very strong point about communication. Communication didn't happen. That means care did not happen. We need to take that. And thanks everyone for participating in this. And I look forward to more meetings like this, because now we have overcome the inertia. I think we will have an opportunity to move forward with great momentum. Thank you.
Srinija garu, meer live work aapandi, but we'll be on a call to talk something good to each other.
Absolutely fine.
If something good needs to be spoken, you can speak on live also. What is wrong with that?
అంత పొగుడుతుంటే జనాలు తట్టుకోలేరు సార్. తిట్లు వెనకాల పొగడ్తలు వెళ్ళలేరు.
Yeah.